Program Magister FKMUI mengupayakan terbentuknya ilmuwan dan praktisi yang bermutu, memiliki kemampuan baik sebagai pendidik, peneliti, konsultan, manajer, serta pengembangan kebijakan. Program Studi Magister Ilmu Kesehatan Masyarakat atau IKM memiliki kurikulum yang dikembangkan mengikuti perkembangan dunia ilmuwan Kesmas di tingkat global, serta penyelenggaraan kuliah yang sudah menerapkan sistem tatap muka dan perkuliahan jarak jauh atau PJJ berbasis e-learning. Tidak heran jika FKMUI telah menjadi tolak ukur pendidikan kesehatan masyarakat di Indonesia pada setiap jenjang pendidikan. Program Studi Magister Epidemiologi menghasilkan magister dalam bidang epidemiologi yang mampu mengembangkan prinsip, metode, dan aplikasi epidemiologi untuk memecahkan masalah kesehatan melalui riset dengan pendekatan interdisipliner dan multidisipliner berskala nasional atau internasional. Program Studi Magister Epidemiologi mempunyai 3 peminatan, yaitu Epidemiologi Komunitas, Epidemiologi Klinik, dan Epidemiologi Lapangan atau FETP. Program Studi Kajian Administrasi Rumah Sakit bertujuan untuk membentuk lulusan dengan profil sebagai pemimpin, pengelola, peneliti, dan pendidik serta konsultan yang berkompetensi dalam bidang komunikasi, manajemen rumah sakit dan keterampilan bisnis, sistem rumah sakitan, kepemimpinan, dan profesionalisme. Kebutuhan akan keselamatan dan kesehatan kerja di masyarakat semakin meningkat seiring berkembangnya investasi industri di Indonesia. Untuk menghadapi tantangan dan kebutuhan tersebut, FKMUI membuka program Magister K3 yang bertujuan menghasilkan lulusan yang mempunyai kemampuan berpikir kritis dan sistematis, berwawasan luas, serta antisipatif terhadap perkembangan keilmuan dan teknologi di bidang K3 dalam mengembangkan dan mengelola program K3 di dunia industri, pemerintahan, dan elemen masyarakat lainnya. FKMUI juga menyelenggarakan program doktor yang terbagi atas 2 program studi, yakni Program Studi Doktor Ilmu Kesehatan Masyarakat dan Program Studi Doktor Epidemiologi. Program Studi S3 Ilmu Kesehatan Masyarakat menghasilkan lulusan sebagai doktor dalam bidang ilmu kesehatan masyarakat yang mampu menjadi pemimpin, serta mampu memberikan rekomendasi kebijakan berbasis data dan menghasilkan penelitian yang inovatif melalui pendekatan interdisiplin, multidisiplin, dan transdisiplin guna mengatasi masalah kesehatan masyarakat baik di tingkat nasional maupun di tingkat Asia Tenggara. Program Studi S3 Epidemiologi menyelenggarakan pendidikan epidemiologi tingkat doktor dalam bidang epidemiologi yang mampu mengembangkan ilmu pengetahuan dan metode epidemiologi untuk memecahkan masalah kesehatan terkait dengan disiplin ilmu epidemiologi. Program Studi Doktor Epidemiologi mempunyai 2 peminatan, yaitu Epidemiologi Komunitas dan Epidemiologi Klinik. FKMUI secara berkesinambungan berkontribusi dalam meningkatkan kesehatan masyarakat melalui program pengabdian masyarakat. Berbasiskan kompetensi yang dipelajari, dosen dan mahasiswa bekerjasama merumuskan permasalahan dan turun ke lapangan dan melibatkan partisipasi aktif masyarakat. Dengan demikian, FKMUI mampu menghasilkan lulusan yang dapat menjawab tantangan pada tingkat nasional maupun global. Guna mewujudkan FKMUI sebagai Center of Excellence Ilmu Kesehatan Masyarakat di kawasan Asia Tenggara, FKMUI memegang peranan penting sebagai mesin pengetahuan dan inovasi yang selalu bergerak dan bertransformasi lebih maju melalui riset dan penelitian. Untuk menjaga atmosfer riset itu, mahasiswa Magister FKMUI melakukan publikasi di jurnal nasional dan proceeding internasional. Sementara mahasiswa program doktor melakukan publikasi di jurnal internasional terindeks sebagai prasyarat untuk melakukan ujian promosi. Berbagai hasil penelitian mahasiswa FKMUI juga telah keluar dalam berbagai publikasi ilmiah dan forum publikasi ilmiah, baik di tingkat nasional maupun internasional. Hingga kini, FKMUI senantiasa berusaha mengaplikasikan ilmu kesehatan menjangkau populasi yang lebih besar, lingkungan yang lebih luas, memberi dampak yang lebih menyeluruh untuk mencapai kesejahteraan masyarakat yang lebih baik.
Matahari yang setiap pagi bersinar, membawa kebaikan yang terus-menerus dan memberi rahmat bagi semesta. Seperti matahari, Bank Syariah Mandiri senantiasa berkontribusi membangun ekonomi negeri. Jaringan dan ATM di seluruh Nusantara yang terus bertambah, membuat kami mampu melayani transaksi berjuta nasabah. Sebagai bank syariah terbesar dengan teknologi terkini dan bersinergi dengan Bank Mandiri, kami memberi lebih dari ekspektasi dengan pelayanan sepenuh hati. Menjunjung tinggi nilai-nilai excellence, teamwork, humanity, integrity, dan customer focus, kami mewujudkan visi menjadi bank syariah yang terdepan dan modern. Bersama kami, Anda seperti berada di rumah, menjalankan bisnis dengan hati yang tenang melalui beragam produk dan layanan terlengkap dalam keuangan syariah. Di sini, kami senantiasa berbagi dan memberdayakan umat menuju masyarakat mandiri. Lewat ikhtiar dan kerja keras, kami membangun perbankan syariah yang terbuka bagi semua mitra, merangkul semua umat bersatu dalam kehidupan yang indah dan penuh berkah.
itu gak ada yang jual. Karena waktu adalah anugerah yang harus disyukuri. Harus bisa dimanfaatkan sepenuhnya. Apalagi untuk ia yang telah memberi waktu seutuhnya. Waktu memang tak ternilai. Untuk kita yang tak mau terus bermimpi. Untuk kita yang menerima tantangan di depan. Jangan biarkan waktu itu terbuang untuk momen yang tak bisa diulang. Jadikan waktu itu lebih berkah. Dengan Mandiri Syariah Mobile, buka rekening sekarang bisa online. Lebih mudah, lebih berkah.
Semua bisa bilang mudah. Itu bisa, itu juga bisa. Tapi kalau mudah sekaligus berkah? Kayak tinggal scan pas bayar kopi, dan klik buat berbagi. Kelihatannya sih lagi asik chattingan. Taunya lagi husu baca Al-Quran. Kirain cuma seneng belanja online. Nyatanya seneng memberi juga. Pas lagi asik kerja berjam-jam, tetap ingat sama kewajiban. Semua bisa di Mandiri Syariah Mobile. Transaksi lebih mudah, berbagi makin berkah. Buka rekeningnya bisa online.
mendesak? Untuk modal usaha, untuk biaya pengobatan, untuk biaya pendidikan, atau untuk kebutuhan lainnya? Gadai emas di Bank Syariah Mandiri solusinya. Gadai emas 1 juta di Bank Syariah Mandiri hanya 7 ribuan per 15 hari. Biayanya ringan kan? Pembiayaannya hingga 250 juta. Prosesnya mudah, cukup menggunakan KTP. Barang jaminan Anda aman. Penuhilah kebutuhan dana instan Anda dengan layanan yang nyaman, yang berkah sesuai syariah. Ingin tahu cara yang mudah agar Anda punya emas? Cicil emas di Bank Syariah Mandiri solusinya. Cicilan emasnya mulai 4 ribuan per hari. Cicilannya ringan kan? Hanya dengan KTP, prosesnya cepat, dan jangka waktunya sampai dengan 5 tahun. Cicil emas di Bank Syariah Mandiri adalah langkah awal memulai investasi dengan emas yang berkah sesuai syariah. Kunjungi website iGold di bsmemas.bsm.co.id. Caranya, klik di sini untuk registrasi awal, kemudian masukkan alamat email Anda, masukkan password, salin kode yang tertera, dan klik login. Kemudian, Anda dapat memilih melakukan simulasi gadai emas atau simulasi cicil emas. Kemudian, Anda dapat memilih kadar karat emas Anda. Lalu, masukkan jumlah berat emas Anda. Pilih jenis jaminan, klik submit. Maka, Anda akan mengetahui besaran pembiayaan maksimal yang Anda terima, biaya pemeliharaan, dan biaya administrasi yang harus Anda bayar. Berkah dalam satu langkah dengan iGold. Hubungi call center kami di 14040. Info selengkapnya di website resmi www.syariahmandiri.co.id.
Dalam masa pandemi ini, penting untuk kita menjaga diri di rumah aja. Tapi kita juga harus mengatur finansial keluarga. Mengatur finansial untuk antisipasi belanja kebutuhan yang mendesak. Atau untuk membayar cicilan yang harus segera dilunasi. Jangan sampai saat kondisi darurat kamu ribet cari cash money. Hidup jadi tenang jika kamu punya dana darurat yang bisa dipakai kapan saja. Solusinya ada di Mandiri Syariah. Dengan berbagai layanan yang membantu kebutuhan finansial kamu tetap aman. Seperti Mitra Guna Berkah. Pembiayaan yang bikin hati tenang karena sesuai syariah dan mampu mewujudkan semua rencana tanpa rasa resah. Prosesnya mudah dan biaya tetap lebih berkah tanpa bunga. Maksimalkan seluruh transaksi keuangan bersama mitra yang berkah. Segera pindahkan payroll di Mandiri Syariah. Mandiri Syariah.
Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Thank you for joining our international webinar, Notes on Handling of COVID-19 in Indonesia and Asia. Nice and warm greeting to all of you. We are honored to welcome our esteemed guest today, General Secretary of the Ministry of Health, Republic of Indonesia, as representative of the Minister of Health, Dr. Oscar Premadi, Master of Public Health. All speakers and moderators today, Rector of Universitas Indonesia, Professor Ari Kunchoro, Master of Arts, PhD. Dean of Faculty of Public Health Universitas Indonesia, Professor Doctor of Medicine Sabarina, Master of Science. And of course, all participants of this international webinar. Our dear speakers and distinguished participants, we are delighted to present you a warm welcome in the 38th online seminar, International Seminar, Faculty of Public Health, Universitas Indonesia, December 12, 2020. Ladies and gentlemen, allow me to introduce myself. My name is Farida Briani Sobri, and I will be acting as the host for our whole event today. This international webinar is held and presented to you by Public Health Doctorate Program, Faculty of Public Health, Universitas Indonesia, Class 2020. Faculty of Public Health 2020. Faculty of Public Health, Universitas Indonesia, Syariah Mandiri Bank, Cijantung Hospital. We also would like to inform you that in this international webinar, we provide an interpreter facility. So if you wish, you use it, you may choose it on your Zoom screen. Ladies and gentlemen, I would like to inform you our agenda for a few hours ahead in this international webinar. First, we are going to sing together our national anthem, Indonesia Raya. Second, the Dean of Faculty of Public Health Universitas Indonesia will greet all of you. Third, there will be greeting and opening of this webinar by the Rector of Universitas Indonesia. Fourth, we are going to listen to keynote speech from the Indonesia Minister of Health that will be presented by the General Secretary of the Ministry of Health, Republic of Indonesia. Fifth, we will proudly present the first section of lecture that will be moderated by Dr. Rita Damayanti, Master of Science in Public Health. On the second session, we will embrace the lectures to learn more from other countries in Asia. And this will be led by Doctor of Medicine Agustin Kusumayati, Master of Science, PhD, as the moderator. Now, let us begin today's event by singing together our national anthem, Indonesia Raya. You all may remain in your current position.
Indonesia
Ladies and gentlemen, since March 11, 2020, World Health Organization has established global pandemic status of coronavirus disease 29 or COVID-19. First COVID-19 case in Indonesia was reported on March 2nd, 2020, and by the 7th of December 2020, the number of cases already reached 581,551. Spread in 34 provinces, which ultimately had an impact to various national fields, including Indonesia's health development. This international webinar, Notes on Handling of COVID-19 in Indonesia and Asia, will present the management of COVID-19 pandemic in Indonesia and Asia that will be presented by experts from our country, Indonesia, as well as from WHO Zero, Thailand, Taiwan, and Hong Kong. To begin our event, we will hear the welcome speech from the Dean of Faculty of Public Health Universitas Indonesia. We would like to invite Professor Doctor of Medicine Sabarina, Master of Science, to deliver a welcome speech. Professor Sabarina, time is yours.
Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, Your Excellency, Minister of Health of the Republic of Indonesia, at this time being represented by the Secretary General of the Ministry of Health of the Republic of Indonesia, Mr. Oscar Primadi, as the keynote speaker today. Our distinguished Rector of Universitas Indonesia, Professor Ari Kuncoro, SAMA, PhD. The moderators, Dr. Agustin Kusumayati, MSc, PhD, Dr. Anda Rita Damayanti, MSPH, and the speakers, Mr. Lieutenant General Doni Monardo, the head of the Indonesian National Board for Disaster Management, Mr. Oscar Primadi, and Mrs. Brian Sri Prihastuti, MPH, Deputy, the Presidential Staff Office, Dr. Iwan Aryawan, MSPH, from the Faculty of Public Health, Universitas Indonesia, Dr. Pem Namgyal, WHO Southeast Asia Regional Office, Mr. Pramon Vivatanakulvanit, BSc Pharm, MBA, PhD, Chulalongkorn University, Thailand, Professor Mrs. Betty Yawensiu, BS, MEM, PhD, from Taipei Medical University, Taiwan, Professor Yanto Chandra, PhD, from Hong Kong Polytechnic University, Hong Kong. All committees and all participants of the international online seminar. With prayers that we are all in good health and in the protection of Allah Subhanahu wa Ta'ala. All praise and gratitude go to Allah Subhanahu wa Ta'ala, the Almighty God, who has given us all the opportunities so that we can gather in this online seminar. On behalf of the Faculty of Public Health Universitas Indonesia, I would like to welcome our distinguished guests, keynote speakers today, to the moderators and the speakers and all participants of the international online seminar with the theme, the Notes on COVID-19 Handling in Indonesia and Asia, today, Saturday, December 12, 2020. Ladies and gentlemen, distinguished participants, COVID-19 began in December last year, and it has a massive impact on our lives for the last 1 year. Reports on December 11, 2020 informed that more than 70 million people in the world were infected by this virus, and around 1.6 million are dead. Indonesia, as the country with the 4th largest population in the world, gave 600,000 infected people, with the death of 18,500 people. This number brings the total number of COVID-19 sufferers in Asia to 18 18,17,000 people, where more than 300,000 people died. In response to pandemic COVID-19, the government has determined the public health emergency on 31st March 2020, which means that the public health measures are instrumental. Many efforts are having been done by many parties, either government, academicians, private and business, community, and media. Primary prevention, which applies health education with health promotion, covering the messages of keeping social and physical distance, using facial masks, and washing hands with soap frequently. In the states of protection in the primary prevention, many countries in the world try to discover vaccine of COVID-19. Thank God that Indonesia is also having the chance to contribute to this COVID-19 vaccine development regarding to increase our immunity. We always wish and pray that Almighty will give blessing to our effort. Ladies and gentlemen, distinguished participants, the Faculty of Public Health Universitas Indonesia has carried out webinar series with various health issues in response to COVID-19. And today we are carrying out the 38th webinar series. An international online seminar this time managed by the students of public health doctoral study from the batch 2020 program as the committee. This seminar will share with us all of the imperative notes of handling COVID-19 in Indonesia and Asia. We gathered this afternoon to talk about the best practices on how we are coping with and overcoming this pandemic. Importantly, we will learn from several countries in Asia about how they deal with the COVID-19 pandemics, whereas our prominent speakers from Thailand, Hong Kong, and Taiwan would share. Distinguished guests, as the organizer, we would especially like to thank Bank Syariah Mandiri for supporting this seminar, as well as several health professional organizations, including the Indonesian Doctors Association, the Indonesian Association of Public Health Experts, and the Association of Indonesian Public Health Educators and Promoters, as well as the Indonesian Association of Epidemiologists. Furthermore, we kindly invite the Rector of Universitas Indonesia to give a speech and officially open our international online seminar. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Professor Sabarina, for such a warm greeting speech to all participants of this webinar. Now let's continue our next agenda, a welcome speech, as well as the formal opening of International Seminar, Notes on Handling of COVID-19 in Indonesia and Asia by the Rector of Universitas Indonesia, Professor Ari Kunchoro, MA, PhD. Professor Ari Kunchoro, screen and time are yours.
Assalamualaikum warahmatullahi wabarakatuh. Your Excellency, Minister of Health of the Republic of Indonesia, Lieutenant General TNI Purnawirawan, Dr. Terawan Agus Putranto, Specialist Radiology, as the keynote speaker today. The Dean of Faculty of Public Health, University of Indonesia, Prof. Dr. Sabarina, MSc. The moderator, Dr. Agustin Ko Sumayati, MSc, PhD, Chairperson of AIPTKMI, Lecturer at Faculty of Public Health, University of Indonesia. Dr. Dr. Rita Damayanti, MSPH, Head of PPKMI, Lecturer at FKMUI. The speaker, Lieutenant General Doni Monardo, Head of Indonesia National Board for Disaster Management. Dr. Oscar Primadi, MPH, Secretary of General of Ministry of Health. Dr. Brian Sri Prahastuti, MPH, Deputy Main Expert of Human Development Staff Office. Dr. Dr. Iwan Iriawan, MA, PSI, Department of Biostatistics and Demography, Faculty of Public Health, UI, and Dr. Prem Namgyal, WHO Southeast Asia Regional Office, Pramon Vitana Pulpanik, BSc Pharmacy, MBA, PhD, Chulalongkorn University, Thailand, Professor Betty Yawen Q, BS, MAM, PhD, Taipei Medical University, Taiwan, Professor Yanto Chandra, PhD, Hong Kong Polytechnic University, Hong Kong. Distinguished guests, we have passed 9 months in the atmosphere of the Covid-19 pandemic. Nearly 66 million people have been infected with the virus worldwide, of which 1,500,000 have died. Asia, as the continent that hosts the most humans, took the number of infected patients by 17 million, with the 300,000 deaths. Indonesia, as a country with the 4th largest population in the world, takes the number of infected patients as many as 560,000 people, with 17,000 deaths. New cases keep increasing, and deaths are increasing every day. There is no sign yet when it will be stopped. All of this make us very concerned and asking when will the COVID pandemic will end? How do we end? And when it will be possible to end it immediately. Humans have learned a lot and studied the character of the virus, how to avoid it, how to deal with it, and how the world is able to return to the normal. Some are successful, some are undergoing, some are still confused about what to do. We have to see all of them as we try to pay attention to some of them, and we take what is good and suitable for circumstances of our country. We are here for that, to share a story of how we have faced and overcome this pandemic. Every country may have different situations and conditions. We believe we can pass the pandemic just like how we passed previous other pandemic. Distinguished guests, the university has facilitated several scientific forums to discuss COVID-19. Offered to the international online seminar gave a different appearance, with a collaboration and sharing from the Ministry of Health of the Republic of Indonesia, the Indonesian National Board for Disaster Management, WHO, CRO, as well as practitioners and researchers in Indonesia and Asia. We hope to take valuable lessons from this forum regarding note on how to deal with and overcoming the COVID-19 pandemic from perspective and experiences that are close to us. I'm grateful Faculty of Public Health, UI, for consistently holding various forums to discuss this situation, and hope to provide more input and solution to the government and Indonesian people, as well as to enhance further cooperation with the government. Mr. Minister of Health, our respected speakers and participants, we thank you for your participation and willingness to share in this forum. May Allah Subhanahu wa Ta'ala always bless us with a good health and provide protection from all disease and danger. By saying Bismillahirrahmanirrahim, this international online seminar with the theme, the note on COVID-19 pandemic in Indonesia and Asia, Saturday, December 12, 2020, I declare officially open. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Professor Ari Kunchoro, for such great welcoming speech and for officially opening our international webinar. Dear ladies and gentlemen, now we will directly hear a speech, Roadmap of Pandemic Handling in Public Health Development from our honorable keynote speaker today, General Secretary of the Ministry of Health, Republic of Indonesia, Dr. Oscar Primadi, Master of Public Health. Dr. Oscar Primadi, we would like to invite you to deliver your speech.
Yeah, thank you. Thank you, moderator. Ladies and gentlemen, first of all, let me convey my apologies from Bapak Terawan Agus Putranto, the Minister of Health Republic of Indonesia, who was before he will be present at this important seminar. Yeah, he have another important duty. Then he will delegate for me to deliver a speak today. And then on behalf of the Minister of Health of the Republic of Indonesia, I will deliver the keynote speech in Bahasa. Thank you. Baik, Bapak Ibu sekalian yang saya hormati, mudah-mudahan suara ini dapat sampai dan terdengar dengan jelas di ruangan Bapak Ibu sekalian. Assalamualaikum warahmatullahi wabarakatuh. Salam damai sejahtera bagi kita semuanya. Om Swastiastu, Namo Buddhaya, salam kebajikan. Yang saya hormati Rektor UI, Bapak Profesor Ari Kunchoro, Ibu Dekan Fakultas Masyarakat, Fakultas Kesehatan Masyarakat Universitas Indonesia, para narasumber, hadirin peserta yang berbahagia. Marilah kita panjatkan puji syukur kehadirat Tuhan yang Maha Kuasa atas karunia-Nya sehingga kita dapat berkumpul di tempat ini dalam rangka seminar internasional kesehatan masyarakat dalam keadaan sehat walafiat. Saudara sekalian, International Health Regulation atau kita kenal dengan IHR merupakan dokumen internasional yang mengikat kewajiban negara-negara pihak anggota WHO untuk mencegah, melindungi, dan mengendalikan penyebaran wabah secara internasional sesuai dengan dan terbatas pada faktor risiko yang dapat mengganggu kesehatan. Dengan sesedikit mungkin tentunya menimbulkan hambatan pada lalu lintas dan perdagangan internasional. Dokumen IHR diluncurkan pertama kali pada tahun 1969 dengan kekhususannya untuk menangani pandemi kolera, pes, dan juga demam kuning dengan memprioritaskan pengawasan di lintas batas. Mohon maaf, apakah slide saya bisa di-share ya? Ini belum ada slide yang host, barangkali bisa lebih jelas. Ya. Slide selanjutnya. Ya, saudara sekalian, dengan sempat mewabahnya flu burung pada awal tahun 2000, WHO bersama negara anggota merasa perlu untuk merevisi dokumen IHR ini untuk memperluas isu agen penyebab penyakit yang meresahkan dunia. Dalam IHR 2005, negara-negara harus mempunyai kapasitas untuk mendeteksi, memverifikasi, investigasi, dan melaporkan serta merespon event kejadian yang berpotensi menimbulkan public health emergency of international concern atau yang kita sebut dengan PHIEC. Baik itu akibat penyakit menular, penyakit akibat terpapar radiasi nuklir, penyakit akibat agen kimia, maupun penyakit akibat tercemarnya makanan. Indonesia telah mengimplementasikan IHR ini tahun 2005 ini untuk membangun suatu konsep keamanan kesehatan global berdasarkan sistem kesehatan nasional yang kuat, yang terhubung dengan kewaspadaan global dan sistem respons. Saudara sekalian, sejak IHR 2005 disepakati mulai dari 2005 itu Indonesia sudah memulai proses advokasi dan sosialisasi secara nasional dengan melakukan pendekatan kepada stakeholders di tingkat nasional maupun daerah. Pada tahun 2007 dilaksanakan proses penilaian oleh WHO untuk mengidentifikasi kekuatan dan kelemahan terhadap kapasitas inti yang ada. Berdasarkan hasil penilaian tersebut, WHO merekomendasikan satu peningkatan kapasitas melalui pendekatan multisektor dengan penekanan pada pintu masuk. Pada tahun 2011 dilaksanakan self-assessment dan beberapa kapasitas inti masih belum mencapai level yang diisyaratkan, sehingga Indonesia meminta perpanjangan hingga tahun 2014. Untuk mempercepat proses tersebut, Indonesia membentuk Komite International Health Regulation yang anggotanya terdiri dari lintas kementerian dan lembaga. Komite IHR ini menyusun rencana kerja untuk memenuhi seluruh kapasitas inti IHR. Indonesia menyatakan implementasi penuh IHR pada tahun 2014 dengan beberapa penguatan. Sementara itu, Bapak Ibu sekalian, pada tahun 2014, negara Amerika menginisiasi untuk menyusun suatu agenda yang kemudian diperkaya oleh negara-negara yang turut menyusun agenda tersebut untuk negara-negara dapat mengimplementasikan IHR atau International Health Regulation tadi dan meningkatkan kapasitasnya dalam menghadapi pandemi. Salah satu hasil penting dari upaya bersama ini adalah tersusunnya instrumen Joint External Evaluation, JEE, untuk mengevaluasi kapasitas suatu negara dalam mencegah, mendeteksi, merespon ancaman kesehatan masyarakat. Pada tahun 2017, Indonesia secara sukarela meminta kepada WHO untuk dinilai oleh tim JEE. Dan pada November 2017, dilaksanakanlah penilaian yang menghasilkan rekomendasi untuk menyusun National Action Plan for Health Security atau NAPHS atau Rencana Aksi Ketahanan Nasional, Rencana Aksi Ketahanan Kesehatan Nasional. Pada tahun 2018, Indonesia mengembangkan NAPHS ini menjadi sebuah dokumen dan di-launching pada tanggal 20 Desember tahun 2019 oleh Bapak Menko Polhukam, Pak Mahfud, ya tahun lalu. Kita launching tentang dokumen National Action Plan for Health Security ini. Saudara sekalian, belajar dari sejarah dalam kurun waktu hampir 15 tahun ini, sejak munculnya flu burung, telah banyak penyakit-penyakit baru yang muncul dan meresahkan dunia. Di antaranya adanya berbagai jenis influenza baru, misalnya adanya Ebola, adanya Zika, adanya MERS-CoV, yang lebih membuat negara-negara makin didorong untuk mengimplementasikan International Health Regulation. Indonesia dalam program kerja kabinet baru di dalam penyusunan arah kebijakan rencana pembangunan jangka menengah nasional atau yang kita kenal dengan RPJMN bidang kesehatan tahun 2020 sampai 2024. Barangkali slide-nya bisa di the next slide, ya. Yang dikoordinasikan oleh Bappenas, di mana salah satu strategi pembangunan bidang kesehatan adalah penguatan sistem kesehatan melalui penguatan ketahanan kesehatan. Adapun strategi kunci penguatan ketahanan kesehatan adalah penguatan surveillance penyakit terpadu, real time dan berbasis laboratorium, penguatan jejaring, mekanisme rujukan, dan akreditasi laboratorium, peningkatan kapasitas tenaga laboratorium, dan juga pemenuhan sarana dan prasarana SDM di pintu masuk masuk negara yang saat ini dijaga oleh KKP, Kantor Kesehatan Pelabuhan kita. Saudara sekalian, dalam melakukan penguatan ketahanan kesehatan seperti yang sudah saya sampaikan di atas, bahwa sudah kita susun apa yang disebut dengan NAPHS tadi, dan kemudian Rencana Aksi Nasional Ketahanan Kesehatan yang di dalamnya memuat peta jalan untuk kurun waktu 5 tahun. Dokumen NAPHS ini bersifat sebagai living document dan merupakan perihal yang penting dan strategis untuk segera diimplementasikan serta menjadi acuan untuk menyusun kegiatan teknis di kementerian lembaga masing-masing, dan acuan bagi para kepala daerah, para gubernur, wali kota, bupati untuk menyusun rencana aksi daerahnya sesuai dengan amanah instruksi Presiden nomor 4 tahun 2019. Saudara sekalian, instruksi Presiden nomor 4 tahun 2019 tentang peningkatan kemampuan dalam mencegah, mendeteksi, dan merespon wabah penyakit, pandemi global, dan juga kedaruratan nuklir, biologi, dan kimia telah ditetapkan pada 17 Juni 2019 yang melibatkan kementerian dan lembaga termasuk gubernur, wali kota, dan bupati tadi. Dengan terbitnya Inpres ini, maka Indonesia telah melaksanakan rekomendasi kedua dari hasil penilaian JEE, yaitu membangun mekanisme koordinasi pelaksanaan IAHR 2005 dan mekanisme kegiatan guna mewujudkan ketahanan kesehatan global yang melibatkan semua kementerian dan lembaga. Diharapkan seluruh kementerian dan lembaga terkait segera mengambil langkah-langkah koordinatif dan terintegrasi sesuai dengan tugas, fungsi, dan kewenangannya masing-masing. Dokumen Inpres ini juga memuat rencana aksi dan di tiap kementerian dan lembaga di dalam mensinergikan kesiapan negara menghadapi bencana. Saudara sekalian, Bapak Ibu yang saya hormati, sebagai slide penutup, izinkan kami sampaikan strategi Indonesia di dalam penanganan COVID-19 ini, di mana upaya deteksi dengan melakukan cegah tangkal pintu masuk negara, kesiapan laboratorium, kesiapan rumah sakit rujukan, pemberdayaan masyarakat, peningkatan surveillance ILI, Seri, dan penyediaan alat deteksi cepat. Upaya pencegahan dilakukan dengan gerakan masyarakat hidup sehat, peningkatan edukasi masyarakat mengenai COVID-19 melalui berbagai media, penyediaan call center untuk menerima keluhan dan laporan dari masyarakat mengenai COVID-19, dan menyusun protokol-protokol kesehatan dan pedoman-pedoman yang dibutuhkan. Upaya respon juga kita lakukan dengan tata laksana kasus, penelusuran kontak, peningkatan komunikasi risiko, observasi kelompok berisiko, kekarantinaan, dan pembatasan sosial berskala besar, social physical distancing, isolasi, serta juga pencatatan dan pelaporan. Penguatan semuanya ini terangkum dalam sebuah langkah yang sekaligus dalam upaya kita menguatkan sistem kesehatan nasional kita. Karena kita menyadari bahwa di saat pandemi ini segala persoalan terjadi, segala masalah terjadi, tentunya komunikasi dan upaya-upaya membangun kebersamaan terus ditingkatkan, termasuk dengan komunikasi dengan negara-negara kawasan regional ASEAN dan juga dunia. Kami terus berkolaborasi bersama membentuk dan membangun kesepahaman agar betul-betul pandemi yang sudah mendunia ini dapat kita lakukan pengendaliannya dengan upaya-upaya kebersamaan dan bersatu di dalam suatu kerangka yang besar, tentunya tidak hanya di lingkup nasional, regional, bahkan pada skala dunia. Bapak Ibu sekalian yang berbahagia, tentunya mengakhiri penyampaian saya ini, marilah kita berkolaborasi dalam melaksanakan penguatan kapasitas negara menghadapi pandemi ini. Kiranya Tuhan yang Maha Kuasa, Allah Subhanahu wa Ta'ala akan memberikan karunia kepada kita semua, kemampuan, kekuatan, dan kemudahan berpikir, sehingga segala yang kita upayakan semakin meningkat, dan tentunya derajat kesehatan masyarakat kita juga semakin membaik. Demikian yang dapat disampaikan. Assalamualaikum warahmatullahi wabarakatuh. Selamat sore Om Santi Om. Salam sehat, sehat Indonesia, Menteri Kesehatan, Bapak Dr. Terawan Agus Putranto. Demikian Bapak Ibu sekalian yang dapat saya sampaikan. Saya yakin ini adalah awal dari sebuah gambaran umum bagaimana Indonesia melangkah dalam kerangka internasional, regional, dalam kita menerapkan International Health Regulation. Kemudian saya yakin nanti pada pembicara kedua yang dari Kementerian Kesehatan yang akan disampaikan oleh juru bicara Kemenkes nanti Dr. Nadia akan lebih spesifik, akan mengupas dan juga memberikan pemahaman kepada kita semua tentang bagaimana Kemenkes dalam mengendalikan COVID-19 ini secara lebih terstruktur dan mempunyai suatu sistem yang saling menguatkan. Bapak Ibu sekalian, demikian penyampaian dari kami atas nama Menteri Kesehatan dan ucapan terima kasih yang sebesar-besarnya. Thank you very much all of the participants. Thank you. Terima kasih.
Thank you very much, Dr. Oscar Primadi, for your informative speech. Ladies and gentlemen, we are going to proceed to the core of this international webinar, the lecture and discussion sessions. But before that, to refresh you, while you probably want to grab little drink or snack, allow us to show the video of our sponsors.
Matahari yang setiap pagi bersinar, membawa kebaikan yang terus-menerus dan memberi rahmat bagi semesta. Seperti matahari, Bank Syariah Mandiri senantiasa berkontribusi membangun ekonomi negeri. Jaringan dan ATM di seluruh Nusantara yang terus bertambah, membuat kami mampu melayani transaksi berjuta nasabah. Sebagai bank syariah terbesar dengan teknologi terkini dan bersinergi dengan Bank Mandiri, kami memberi lebih dari ekspektasi dengan pelayanan sepenuh hati. Menjunjung tinggi nilai-nilai excellence, teamwork, humanity, integrity, dan customer focus, kami mewujudkan visi menjadi bank syariah yang terdepan dan modern. Bersama kami, Anda seperti berada di rumah, menjalankan bisnis dengan hati yang tenang melalui beragam produk dan layanan terlengkap dalam keuangan syariah. Di sini, kami senantiasa berbagi dan memberdayakan umat menuju masyarakat mandiri. Lewat ikhtiar dan kerja keras, kami membangun perbankan syariah yang terbuka bagi semua mitra, merangkul semua umat bersatu dalam kehidupan yang indah dan penuh berkah.
Welcome back, ladies and gentlemen. We would like to inform you that today's event will be divided into two sessions. First session is the pandemic management in Indonesia that will be moderated by Dr. Rita Damayanti, MSPH. In the second session, we are going to learn from other countries about how to handle the situation. Doctor of Medicine Agustin Kusumayati, Master of Science, PhD, will be the moderator of this session. For each session, the committee will give an attendance link at the end of it. Either you follow our webinar through Zoom or YouTube, you will find or you will fill the attendance list using the Google form. Please do notice that certificates will only be given to participants who fill the attendance link both in the first and second sessions. Now, let's begin the first session, Pandemic Management in Indonesia. Dr. Rita Damayanti, Master of Science in Public Health, who is going to the moderator, and also she is the head of doctorate program of Public Health Universitas Indonesia. Dr. Rita is also the chairman of Indonesian Society for Health Promoter and Educator. Dr. Rita, please kindly lead this session.
Thank you very much, Ibu Farida. A very good afternoon, distinguished ladies and gentlemen. It is an honor for me to facilitate the first sessions of how in Asian handling COVID-19. In these first sessions, we will discuss how Indonesians handling COVID-19. So, without any further delay, I will introduce the first speakers. The first speakers is Professor Wiku Adhisa Smito. He will represent the Lieutenant General Doni Murdano from the Task Force from COVID-19 Management. Prof. Wiku right now is a spokesman of the task force. So we always see him in the news related to COVID. He is very, very busy because he lead the expert team to support many policies in handling COVID-19. But don't forget, he is a professor from Faculty of Public Health also. Professor Wiku, the time is yours. 15 minutes.
Okay, thank you very much, Dr. The moderators, and also Dr. Rita Damayanti for the introductions. Let me, first give the apologetic statement from the chair of the task force of the COVID-19, Lieutenant General Doni Monardo, that cannot attend this important meeting or webinar this afternoon, and he asked me to represent him. And let me share the details of what we are doing in the governments to see how the COVID-19 has been tackled by the government of Indonesia and the results. Let me see if I can share this document. First, I'd like to show you the impact of this COVID-19 pandemic on health by playing this video, which is important for everybody to understand the root of the cause and how we can respond in the future. Okay, if you look at that video, I hope that reminds you all that there is a challenge from the environment, which is the disease of tomorrow. What I call it disease of tomorrow, because we don't know what's going to happen tomorrow. And if we look at the emerging infectious diseases since these publications in 2004 in Nature, emerging and re-emerging infectious disease challenges, you can see that there are more than 30 emerging infectious diseases, and up to now, 16 years later, there are already 4 emerging infectious diseases. It's becoming problematic in the world and causing millions of casualties, deaths in the world. And this is going to be happening probably in the future because of the imbalance of nature, as I mentioned earlier through the video. And that's why we need to make sure that the way we manage the environment has to be careful because of the overpopulations and the scarcity of the resources. And if the way that the government of Indonesia in dealing with this, we are challenged with the lack of the data about COVID-19 everywhere in the world. So that's why we generated the data through the reporting systems throughout the country, through the health districts and also the other stakeholders across Indonesia, including the national level. And we collect the data and then we make it into one big data and then we analyze it and then we report it to the public so that we know the impact of this disease. But back to the issue is that all of the countries now attacked by the COVID-19 because the resiliency of the public health systems in their countries, including Indonesia, are lacking. And that's why we are struck with this disease. And that's why when we know with the problems, we need to move all of the people in Indonesia to fight against this infectious disease. So that's why the public communication is also key in responding to this issue. And then up to date, the daily positive case up to now, at least from the yesterday case, it's 6,310. But if you look at the total active case, we are a bit lower than the global picture. We are 14.8%, where the global active case is 28.39%. Well, the total recovered is almost 500,000 or 82.1%. Where the total recovered in the world is 69.35%. So as the fourth most populous country, we are contributing big in terms of the populations and also the cases. So that's why when we are able to control the disease, it means that we are also controlling the pandemic in the world. So that's why the vigilance of the people in Indonesia and all stakeholders are very important to see that. And we have to protect the death from the people. So that's why it has been lowering from time to time, but we need to suppress this so that it can be lower than the global rate. So this is the national active cases from time to time. It's a lot of reductions, but then you can see on December, it seems that it's flattening and a bit increase. So that's why we need to control these situations. In terms of the death rate, it's reduced from time to time, but still we need to suppress this. And national recovery rate has been increased, but in the December, it's tend to reduce a bit because of the number of the cases. And we are monitoring the situation in Indonesia through the integrated system. We call it Bersatu Lawan COVID, where first we look at the number of the cases through the zonation risk map based on the public health indicators with a high risk, moderate, and low risk, and no new cases, which is from the low or moderate or high risk, and then they can, in one week, that they can control the situations. And then also there are several not affected areas in Indonesia. And then also we monitor the behavior of the people across Indonesia. And you can see this, that we are mapping this through the systems, reporting from the field. And I will mention later on. So this is the risk donations. We report every week the change. And you look at that the high risk from the 50 to 47 districts and cities, and it's a reduction, which is good. But then the number in the medium risk and low risk is high, relatively high, and we have to make sure that we can shift to the right so that they go to the low risk or not affected districts. And then about the behavior change monitoring systems, and you look at this is about 2 months right now, that 20 million people being monitored right now in terms of their behavior regarding the COVID. And then if you look at this, every week we also report this, and we know that up to now 159 million people being monitored, and the total point being monitored is 40 million out of 512 districts and cities in Indonesia, and all 34 provinces. And we look at this, its compliance to the health protocols about wearing mask and physical distancing. The picture is not that good looking at the behavior change monitoring, because this is what we have to work hard to make sure that the number of the people or the percentage of the people wearing masks should be increased, as well as the physical distancing in specific areas. So this is the responsibility of the local leaders, the district leaders, the mayor, the bupatis, and also the governors all across Indonesia be responsible for their own areas. And this is also the distributions of the facilities about what we monitor, not only the people, but also the institutions. So we look at the facilities, the hand washing, the hand sanitizer, health protocol socializations in their facilities, and also body temperature checking in their area and cleanliness in the area. So this is the situations. So we monitor every day. we work with more than 97,000 armed forces across Indonesia, and then more than 217,000 police, and also more than 47,000 ambassadors of the behavior change, which is including the public servants across Indonesia. So they report every day to us, every second. We receive more than 5 to 10 reports per second with the pictures, and then the count of the number of the people wearing masks compared to not wearing masks, and also social distancing. So this is the result. So that's why when we know these situations, so that the police and others who can directly respond and in the field to control the situations. And about the testing, tracing, and treatment. First, the number of the laboratories has been increased from the beginning in March, starting from 1, which is from the NIHRD Ministry of Health, and now we have more than 510 laboratories across Indonesia that can test the COVID-19. And then, according to the target, we are almost 100% targets at this moment with the WHO targets. However, the distributions of areas, meaning in the provinces, are still uneven, and this is our homework to make sure that all areas, especially with the high population density, have to have or compliance to the WHO standards in terms of the testing. And what we are working hard is really to change the situations from the public health emergency right now into improving the public resilience. This is investment for us all, and we have to make sure that everybody in Indonesia, starting from the very lowest or the smallest group, which is the households, up to all across Indonesia, have to make sure that they have a good behavior in terms of what we call it iman, aman, and imun, so that they do the worships and to improve the immunity, and then 3 M's, wearing mask, physical distancing, and wash hands frequently, as well as enough rest, exercise frequently, and they don't panic and stay positive and eat healthy food, so that it will improve the public health resilience, not only for COVID-19, but also from other emerging infectious disease that may be coming to the world or to Indonesia, including Indonesia. So the last point that I would like to say that we need to be united against COVID-19, since this disease is so dangerous, and they work on the lack of immunity in the people. When we are scared, our immunity is lower. So that's why we have to be united. We have to be happy in difficult situations. So it's really difficult for everybody to face with this, because we have to improve our immunity while also fighting with this, not to get infected. So I hope this is what we can share with you all. I hope that this is beneficial for us together to fight with this disease. Thank you very much for your attention. I'll give it back to Ibu Rita Damayanti. Thank you very much.
Yeah, thank you, Professor Wiku. We have already learned about the comprehensive situations about COVID in Indonesia, and the interesting one is there's a low compliance on institutional behavior. It's only 15%. Yeah, this is amazing. Yeah. Because maybe punishment can help actually, yeah, for the institutions that did not use the protocols. Okay, thank you, Prof. Wiku. And for the next speakers, we will invite Ministry of Health that represent by Dr. Siti Nadia Tarmisi, Master in Epidemiologist. Yeah. She is the director of penyakit menular, yeah, and she will share with us about the policy on COVID-19 management. The time is yours, Ibu Nadia.
Thank you, Dr. Rita. First of all, can I share a screen by myself?
Sure.
Oh, okay. Thank you. Okay. Okay. Thank you, Ibu Rita, as the moderator. Allow me to deliver my presentation in Bahasa. And first of all, because of Pak Secretary General already delivered the speech of the Ministry of Health, so I will give his presentation this afternoon. Pertama-tama kami mengucapkan tentunya terima kasih atas kesempatan yang diberikan untuk bisa bergabung di dalam seminar internasional kesehatan masyarakat yang diselenggarakan pada siang hari ini. Tentunya pada kesempatan ini kami akan menyampaikan terkait kebijakan penata laksanaan pandemi COVID-19, tentunya melengkapi apa yang sudah disampaikan oleh Prof. Wiku pada sesi sebelumnya. Ini mungkin tadi sudah disampaikan oleh Prof. Wiku mengenai kasus jumlah COVID-19, hanya saja mungkin sedikit untuk menguatkan bahwa dari grafik sejak awal kasus COVID-19 sampai dengan hari ini, kita memang melihat pada saat akhir September-Oktober di mana ada libur panjang, kita melihat kemudian 2 minggu kemudian terlihat peningkatan kasus sebagai akibat daripada libur panjang ini. Mungkin karena tadi 3M-nya sudah agak sedikit melemah dan memang harus terus-menerus untuk kita ingatkan kepada masyarakat. Saya langsung saja karena sudah disampaikan oleh Prof. Wiku sebelumnya. Nah, sesuai dengan Keputusan Menteri Kesehatan nomor 413 bahwa tujuan penanggulangan COVID-19 adalah memperlambat dan menghentikan laju penularan serta menunda penyebaran penularan, menyediakan pelayanan kesehatan yang optimal untuk pasien, terutama untuk pasien-pasien kritis, serta meminimalkan dampak dari pandemi COVID-19 terhadap sistem kesehatan, pelayanan sosial, kegiatan di bidang ekonomi, dan kegiatan di sektor lainnya. Jadi kata resilience yang tadi disampaikan oleh Prof. Wiku itu menjadi tentunya tujuan kita bagaimana upaya kita dalam hal ketahanan kesehatan masyarakat kita. Nah, apa yang dilakukan oleh Kementerian Kesehatan tentunya dalam menghadapi pandemi COVID-19 ini sudah disusun berbagai standar pedoman serta acuan untuk bisa dilaksanakan oleh Fasiankes di seluruh Indonesia. Kita sudah melihat pedoman kesiapsiagaan menghadapi infeksi coronavirus 19 ini sudah ada sampai dengan revisi kelima. Pada waktu revisi pertama, namanya saja masih novel coronavirus 2019 nCoV, tapi sejak pedoman revisi kedua sudah berubah menjadi COVID-19. Jadi ini memang adalah suatu pedoman yang luar biasa. Dalam kurun waktu 10 bulan sudah terbit 5 pedoman dan tentunya menyesuaikan dengan kondisi perkembangan kasus, perkembangan informasi, serta perkembangan kebijakan. Apa yang dilakukan dalam kita mengatasi pandemi COVID-19, kita semua sudah tahu bahwa strategi yang kita lakukan dalam upaya menangani dan menghadapi pandemi COVID-19 adalah kita melakukan penerapan protokol kesehatan. Baik itu protokol kesehatan dalam rangka perlindungan kesehatan individu dan protokol kesehatan dalam rangka perlindungan kesehatan masyarakat. Dalam rangka perlindungan kesehatan individu, tadi juga sudah disampaikan 3M, dan bahkan sekarang dengan imun, aman, dan ditambah tentunya dengan perilaku hidup bersih dan sehat selain 3M yang sudah menjadi tren untuk penerapan protokol kesehatan pada kesehatan individu. Sementara protokol kesehatan masyarakat adalah kita melakukan prevent, detect, dan respon. Prevent adalah mulai dari komunikasi, informasi, dan edukasi, melakukan screening, melakukan sosialisasi, kemudian melakukan berbagai aktivitas desinfeksi. Detect tentunya berdasarkan zonasi, titik kritis, kemudian kelompok berisiko, penyediaan laboratorium, serta merespon. Merespon mulai dari tracing, kemudian pemeriksaan laboratorium untuk tata laksana, dan tentunya penanganan penderita. Yang kedua tadi yang kita sampaikan adalah perluasan pemeriksaan laboratorium. Pemeriksaan COVID-19 memang merupakan tantangan di awal-awal daripada kita menghadapi pandemi COVID-19. Saat ini pemeriksaan untuk COVID-19 kita menggunakan deteksi secara molekuler, perluasan laboratorium real-time PCR, termasuk penggunaan secara bersama mesin tes cepat molekuler yang selama ini digunakan di tuberkulosis, dan pemeriksaan dengan menggunakan mesin viral load yang selama ini digunakan di dalam program HIV/AIDS. Ini digunakan untuk menegakkan diagnosis melalui spesimen yang diperiksa dengan mengambil swab nasofaring ataupun orofaring, dan perlu 2 kali hasil pemeriksaan dengan jarak minimal 24 jam untuk mendiagnosis. Kemudian rapid test antibody, walaupun ini tidak direkomendasikan sebagai diagnostik oleh WHO, masih kita gunakan untuk tentunya bukan sebagai diagnostik ya, tetapi untuk survei ataupun pada kelompok-kelompok khusus yang sudah kita tentukan di dalam pedoman. Kemudian ini akan ada lagi rapid test antigen yang merupakan alternatif alat untuk diagnostik, khususnya pada wilayah-wilayah yang tidak memiliki kapasitas real-time PCR, ataupun pemeriksaan PCR-nya ini membutuhkan lebih dari 2-3 hari. Termasuk juga daerah-daerah yang harus mengirim spesimen ini ke laboratorium rujukan yang membutuhkan mungkin biaya jauh lebih besar daripada biaya pemeriksaan RT-PCR tersebut. Sama, ini spesimennya diambil dalam bentuk swab nasofaring. Ini adalah laboratorium, 422 laboratorium, khususnya laboratorium RT-PCR, baik itu adalah dengan menggunakan RT-PCR, dalam hal ini adalah open maupun closed system, serta penggunaan bersama mesin viral load dan mesin TCM yang ada di fasilitas pelayanan kesehatan. Ini merupakan juga salah satu upaya kita memperluas, karena awalnya hanya kurang dari 50 laboratorium pemeriksa ini yang kemudian dikembangkan, bahkan juga bekerja sama dengan balai laboratorium lainnya seperti milik Badan POM ataupun juga balai besar veteriner milik Kementerian Pertanian. Kemudian yang kita lakukan kedua adalah selain perluasan laboratorium, ketiga yang pertama tadi adalah penerapan protokol kesehatan, yang kedua adalah perluasan daripada diagnostik, yang ketiga adalah melakukan pelacakan kontak. Pelacakan kontak merupakan kunci utama untuk memutus rantai penularan COVID-19 yang tentunya harus didukung oleh masyarakat dan memiliki perencanaan yang matang, tidak ada stigma dan diskriminasi, serta adanya komunikasi risiko yang baik. Perlu didukung juga dengan logistik, SDM maupun sistem manajemen data yang terbaik. Saat ini sudah ada kurang lebih 3.841 relawan sebagai kontak tracer yang tersebar di 10 provinsi. Ini juga merupakan kerjasama dengan Satgas bidang kesehatan COVID-19. Ini ada aplikasi yang bisa kita gunakan untuk dalam rangka untuk yang kita sebut sebagai aplikasi lacak COVID, alur untuk pelacakan kasus, dan ada buku panduan tentang bagaimana melakukan kontak tracing untuk kasus COVID-19. Yang keempat adalah tentunya penguatan strategi dan upaya di fasilitas pelayanan kesehatan, mulai dari penambahan jumlah rumah sakit rujukan COVID, kemudian implementasi protokol kesehatan di Fasiankes sesuai dengan SK Menkes 1591. Kemudian mendirikan rumah sakit darurat COVID atau rumah sakit lapangan, melakukan sosialisasi dan berbagai workshop terkait buku pedoman COVID-19 dan protokol tata laksana COVID-19 yang merupakan protokol yang disusun oleh 5 organisasi profesi. Kemudian melakukan penataan sistem rujukan dalam pelayanan COVID melalui rute dan peningkatan kapasitas tempat tidur isolasi dan ICU untuk perawatan COVID-19 lebih dari 30% sesuai dengan surat edaran Dirjen Yankes, termasuk juga pemenuhan sarana dan prasarananya. Saat ini sudah ada 920 rumah sakit rujukan COVID-19 yang merupakan rumah sakit rujukan yang ditetapkan oleh SK Menkes, SK Gubernur maupun SK Bupati dan Wali Kota. Ada total 53.360 tempat tidur isolasi COVID-19 dan ICU COVID-19 dan di dalam 920 rujukan COVID, tempat tidur isolasi dan ICU ini ada berjumlah juga 36.000. Ini adalah berdasarkan kepemilikan dari 920 rumah sakit ini. Selanjutnya dalam rangka pemenuhan pasienkes, yang kelima adalah pemenuhan akses dan sediaan sarana farmasi dan alat kesehatan dalam penanganan COVID-19. Yang pertama adalah terkait pengadaan dan distribusi obat, yaitu obat-obat sesuai dengan protokol atau pedoman di dalam tata laksana COVID-19 yang didistribusikan ke provinsi dan rumah sakit rujukan. Kemudian relaksasi perizinan, one day service untuk pelayanan izin untuk dalam rangka meningkatkan produsen dan izin edar, sehingga terdapat peningkatan jumlah produsen masker sebesar 811%. Kemudian fasilitasi hilirisasi rapid test dan ventilator, di mana juga sinergi Kemenkes, perguruan tinggi termasuk Universitas Indonesia yang kemarin juga sudah menghibahkan ventilatornya ke beberapa rumah sakit rujukan COVID, dan juga lembaga penelitian serta dunia usaha dalam rangka menumbuhkan tentunya potensi dalam negeri. Sampai saat ini sudah ada 15 produk rapid test dan 14 produk ventilator produksi dalam negeri. Kemudian post market alat kesehatan dalam rangka pemastian produk alkes dan di peredaran melalui inspeksi sarana produksi, sampling dan pengujian produk serta pengawasan iklan, maka sudah dilakukan inspeksi ke sarana, sampling dan uji laboratorium sebanyak 311 produk dan pengawasan terhadap 2.709 alat kesehatan yang terkait dengan iklan yang diberikan. Terkait pemenuhan sumber daya manusia, ini total relawan tenaga kesehatan yang bergabung di dalam Nusantara Sehat serta intensif dalam rangka mendukung upaya pandemi COVID-19, hampir kurang lebih 20.000 orang, di mana rinciannya adalah relawan sebanyak 4.100, Nusantara Sehat dalam bentuk tim maupun individu adalah 7.800, dan intensif di 582 rumah sakit sebanyak 7.800 orang. Selanjutnya dalam rangka kaitan peningkatan kapasitas tenaga kesehatan, ini adalah beberapa workshop dan pelatihan yang dilakukan dengan total dalam 10 bulan ini dilakukan berbagai sosialisasi peningkatan kapasitas untuk tenaga kesehatan maupun tenaga lainnya dalam rangka peningkatan kemampuan tata laksana pada COVID-19 dengan total kurang lebih peserta sebanyak 73.785 orang. Pada prinsipnya bahwa dalam menghadapi pandemi COVID-19, Kementerian Kesehatan melakukan penggerakan semua lini daripada sistem kesehatan nasional. Mulai dari tadi disampaikan berbagai upaya kesehatan, kemudian yang kedua adalah pembiayaan kesehatan, mobilisasi pembiayaan yang bersumber pemerintah maupun swasta melalui berbagai donasi maupun CSR, serta memobilisasi tentu pembiayaan yang bersumber masyarakat. Sumber daya manusia sudah saya jelaskan. Kemudian peralatan kesehatan, di sisi lain untuk penelitian dan pengembangan kesehatan, kita juga berpartisipasi dalam solidarity trial untuk terapi, serta melakukan uji coba dan pengembangan vaksin COVID-19, serta melakukan pengembangan metode deteksi dan studi epidemiologi molekuler COVID-19. Untuk manajemen dan informasi kesehatan, penerapan sistem informasi yang terintegrasi melalui satu data kesehatan Indonesia. Selain itu juga platform all record sebagai sistem pelaporan laboratorium serta pelaporan surveillance melalui kegiatan yang dilaksanakan oleh Public Health Emergency Operation Center. Untuk pemberdayaan masyarakat, mulai dari poster digital untuk masyarakat, gerakan 3M, kemudian pedoman pemberdayaan masyarakat, desinfeksi dan penyediaan sarana CPTS, kemudian melakukan berbagai kampanye penerapan protokol kesehatan di segala aktivitas, dan tentunya perbaikan sanitasi lingkungan, termasuk juga bekerja sama dengan pondok pesantren dalam hal penanganan pandemi COVID-19. Yang kita lakukan terakhir adalah dalam rangka menunjang adaptasi kebiasaan baru, yaitu kita memastikan untuk masyarakat dapat melakukan aktivitas sehari-hari dengan tetap aman dari COVID-19. Banyak protokol yang sudah kita keluarkan, mulai dari panduan pencegahan pengendalian di tempat kerja perkantoran, industri, di bandar udara, kemudian pengamanan penertiban, sampai dengan tempat kerja, sektor jasa, dan perdagangan, serta ini juga diikuti berbagai media KIE dan juga poster terkait bagaimana implementasi protokol kesehatan yang tadi di awal untuk bisa diterapkan di dalam masyarakat. Selanjutnya, terakhir, selain 3T, 3M, sekarang ada berita baik, kita punya vaksinasi yang memang saat ini kita masih menunggu hasil uji klinis dan juga izin dari Badan POM serta MUI tentang kehalalan dan emergency use authorization. Tapi yang ingin kita pesankan bahwa walaupun vaksinasi sudah ada, 3T tetap dilaksanakan dan 3M terutama juga harus tetap dilaksanakan oleh masyarakat. Ini adalah peta jalan vaksin COVID-19 mulai dari mengembangkan vaksin COVID merah putih dengan bekerja sama dengan perusahaan pembuat vaksin dalam dan luar negeri, kemudian melakukan pembelian vaksin secara langsung dari luar negeri yang memenuhi kriteria tentunya aman, mutu, efikasinya, dan harapannya efektivitasnya juga akan berjalan dengan baik. Selain itu, ini adalah vaksin merah putih yang merupakan konsorsium dari Kemenristek-BRIN, Eijkman, Badan Litbangkes, dan Bio Farma. Dan yang terakhir adalah menggandeng lembaga internasional seperti CEPI dan Gavi untuk mendapatkan akses vaksin dalam kerangka kerjasama multilateral. Yang juga dipersiapkan Kementerian Kesehatan dalam pelaksanaan imunisasi COVID-19 ini adalah menyiapkan berbagai sumber daya, rantai dingin, dan sistem informasi termasuk kesiapan daripada fasilitas pelayanan kesehatan. Sudah ada kurang lebih 29 vaksinator dan kita memastikan bahwa puskesmas sampai dengan tingkat puskesmas sudah memiliki rantai dingin yang berfungsi sesuai dengan standar WHO, sistem aplikasi, sistem informasi ini dengan bekerja sama dengan Bio Farma dan BPJS juga sedang dalam proses pengembangan dan tentunya penguatan pelatihan serta informasi kepada seluruh fasilitas pelayanan kesehatan dalam rangka kesiapan menghadapi pelaksanaan imunisasi COVID-19. Sebagai kesimpulan, walaupun Indonesia saat ini masih terus melaporkan kasus COVID-19, tetapi kita masih tetap berupaya untuk melakukan penanggulangan semaksimum dan seoptimal mungkin. Upaya pencegahan pengendalian COVID-19 ini dilakukan sesuai dengan KMK nomor 413 tentang pedoman pencegahan pengendalian coronavirus 2019 yang merupakan pedoman revisi kelima. Berbagai kegiatan sudah dilakukan mulai dari kegiatan surveillance, diagnosis laboratorium, manajemen klinis, dan pengendalian penularan sampai dengan penyediaan sumber daya. Dan dalam masa pandemi COVID-19, seluruh sistem kesehatan nasional ini juga bergerak untuk mendukung upaya kita menghadapi dan bisa keluar dari situasi pandemi COVID-19 ini. Demikian yang bisa saya sampaikan. Terima kasih. Saya kembalikan kepada Dr. Rita.
Thank you very much, Dr. Nadia, for the comprehensive information. Yeah, so we learned that Ministry of Health already conduct many things, facilitate many things, but also we still know that the COVID still raised. Yeah. Okay. So for the next session, we will invite the third speakers. Yeah, the third speakers will be Dr. Brian Sri Prahastuti, MPH. Yeah, she's now working in Secretariat Office for the President as an expert on Deputy of Social Cultures and Ecology Strategies. So Now she will share with us issues about collaboration of government, NGOs, and community in handling COVID-19. Ibu Brian, the time is yours. 15 minutes.
Yes, thank you very much, Bu Rita. Good afternoon, ladies and gentlemen, and the Excellency, the representative from the Ministry of Health and also from the National Body Emergency Management. Professor Ari Kuncoro from the President of Indonesia University, and also Ibu Sabarina, the Dean of Public Health of University Indonesia. Ladies and gentlemen, so for the next 15 minutes, I will present the title of the title of collaboration among government, NGOs, and community. And sorry, this is my profile. So my position right now is the senior advisor at the Executive Office of President. And under my responsibility is for health, women, and children. This is under the Deputy of Human Development. This is the outline of my presentation. It will be 3 sessions. The first is about the characteristic of Indonesian. And second, the main topic of this discussion is the government and civil society collaboration. And the last is about the challenges and the constraints that Indonesia is facing right now on handling the COVID-19 pandemic. It is well known that Indonesia is a plural society. We know that we have a huge number of population in Indonesia, so many tribes, ethnic, and then this population is distributed in island. That's why our country called as an archipelago. So the pluralism, the plural society is become the strengths, but also for some cases it's become the weaknesses, the challenges that we have. And there is a unique culture that we have called as gotong royong. To be honest, I cannot find the correct translation of gotong royong in English. It can be the mutual cooperation, but also working together. But basically, gotong royong is a culture of Indonesia for living together in a group in order to be able to solve the problem. And Kuncoro Ningrat actually divided this gotong royong into 2 types: help each other and community services. Help each other, for example, if my neighbor is preparing for wedding party of their daughter, and then I voluntarily help my neighbor on preparing that wedding party. But the community service is, for example, the villager, the member of village working together to clean the village, for example. That's community services. Both are type of gotong royong. And we also know that human is individual as well as social God creation that has ability, need, and habit to communicate and interact and living together with other human beings. This is the natural of human being. So again, gotong royong is a culture, reflects Indonesian nation behavior since our ancestor. But again, what I know, the gotong royong actually is also exists in other country in Asian. So gotong royong also the value and behavior. It is a common practice across nation in Indonesia with different name. And as a value, gotong royong is a reverse of behavior, views of life if in any forms. But as behavior, gotong royong is actually the individual action without any returning consequence to do something together for common and certain individual interests. So gotong royong is a must value and behavior. It is exists in our life in Indonesia, especially when we live in neighborhood and in the same area in Indonesia. Gotong royong also used as a value and behavior basis in order to increase the bond of togetherness. The value of gotong royong is togetherness, tolerance, consent, and respect. And there is a study in 2018 saying that Indonesia actually is known as the most generous nation, yeah, based on the World Giving Index. There are three benchmarks used for this assessment: helping for donating money and volunteering. I remember in the beginning, Pandit, there is one community-based organization who successfully collect money from individual in Indonesia, and this money is used to buy the self protection equipment, APD, for the health professional, and also to support other activity as a contribution of civil society on the pandemic COVID-19. Yeah, that's what I describe is the gotong royong, is the value. But again, this value need to be formulated as a collaboration of government and civil society. I do not really mention the non-government organization, because for me, non-government organization is kind of the civil society organization. It is the organized civil society. So the most important is the collaboration between the government and civil society. And collaboration of government and civil society organization is something that actually can be happen, because both have the same goal, improving the community welfare. And for this case, the community welfare, what I mean is the free from the COVID-19 pandemic. Theoretically, key factor to have a good government and civil society collaboration. There are 5 key points. One is the participatory of the community. And this is only happen if the community can consider the problem is important for them. And to achieve this status, data availability and openness is critical. Second is the right representative of community and the government for mutual understanding about the issue, of course. And for this, the critical is about the equity and equality. And this is the challenge of Indonesia. And third is achieving the agreement not only for the commitment, but also for joint action. And to ensure collaboration can be achieved, capacity building both parties also important. And the last is continued reflection and sharing lesson learned during the process of collaboration. So we talk about the collaborative governance. There are some experts talking about the collaborative governance. You can read from presentation here, but this is very clear stated that for the collaborative government, it is important to have the arrangement of public agencies that directly involve with non-public stakeholders in a formal, consensus-oriented, and deliberative decision-making process that aim, of course, to develop or implement public policy. Okay, that's the two sessions. The last session is about the challenges and constraints that Indonesia is facing right now during on handling the COVID-19 pandemic. I have 3 points in here. The first is about the trend of COVID-19 cases in Indonesia and the President direction on COVID-19 management. But this already explained very, very well with by Professor Wiku as a spokesperson of COVID-19, and also the president direction is also part of the roadmap and partially already explained by Dr. Nadia from Ministry of Health. And the last is about the lesson learned. But let me summarize the situation. This is the figure in here is not the up-to-date figure. I put this as a data of 28 November 2020, but 3 things, the highlight of the COVID-19 cases in Indonesia is that we have the improved recovery rate, decreased case fatality rate, and increased testing capacity. This is those 3 things already explained very clear by Prof. Wiku. And another that I want to mention in here is we know that the consequence of COVID-19 pandemic is implied to all aspects of human life beyond health, not only health, but this gives the implication to the social, to the economic, and other aspects. And also we know that during the pandemic, at home daily activities and limited mobility become the challenges of social, economic, and cultural life. And the last is that government of Indonesia implement policy towards safe and productive new normal life. So it means that we are ready not up to the end of the pandemic, but to control the pandemic. So the next behavior that we expect is the new behavior that's safe and productive. Yeah, this is the president direction related to handling the COVID-19 from the 14th September 2020. There are 9 directions, but I only want to highlight the first direction, which is the local-based intervention. And this is actually the area that community, my apology. This is the area where the community can contribute to the government effort on handling the COVID-19. In here, because there is a room for the sub-national, for the local institution, and also the role of sub-national, or even the village, or even the sub-village leader, formal and informal. And the last 2 slides is about the lesson learned that we have on management of COVID-19. First is the holistic approach. We learned that how we manage the COVID-19 in Indonesia, we have to have the holistic approach. It's the combination of preventive, promotive, and also curative efforts. And the approach also not only for health, but also the combination of approach economic and also social. And the second is about the dissemination and education about the health protocol and policy, which has to be proper. We in Indonesia, we are very fast to draft, and then to draft about the health protocol. I remember only in the first week of the first case in Indonesia, we already developed the health protocol. But then we also learned that the proper dissemination has to be improved and massive conducted. And the last is community engagement and participation. This is the area, the topic that we're talking about. And then this is the challenges and constraints. We know that the COVID-19 pandemic, there is a challenge of dependency because of the globalization. There is a dependency inter-country, and then inter-country, and then the impact that very wide, again, not only for health, but also social, economy, culture. So it's become a big problem. And second is as disaster, I will consider this COVID-19 pandemic as a prolonged disaster. We already in a 9-month disaster. Yeah, so this is one challenges. And then another also, the last is that this pandemic is not only about the communicable disease pandemic, but also give an implication to other health problems. So it means that now we have to see again, to revisit our epidemiology, the disease pattern in Indonesia. I believe the disease pattern is changed now. And also we have to see also the health services, the existing health services in Indonesia. Some of the health services is disrupted because of the pandemic. So these 3 challenges and constraints can direct us to revisit our existing health system and see whether this health system is still fit with the current situation, still fit with the changing situation of Indonesia, or maybe the global. Yeah, that's all of my presentation. Thank you very much. And I will give the time to the moderator, Bu Rita. Thank you very much.
Thank you, Ibu Dr. Brian, for the informations, that collaborations with private sectors and also community engagement, it's very important in handling the COVID-19. So the last but not least, our speakers is Dr. Iwan Aryawan. Yeah, Dr. Iwan Aryawan is lectures in public health. Yeah, but right now he is very busy as a consultant in Bappenas for modeling related to COVID pandemic. Yeah, he's also frequently invited by the Secretary Office for President, to give many informations about the modeling. So Pak Iwan Aryawan, 50 minutes, the time is yours.
Thank you, moderator. And thank you for the opportunity to share my thought and my analysis on this session. So I will share my screen and then I will do it in 15 minutes. Okay. Okay. So I will talk about the future of this COVID epidemic or pandemic in Indonesia. So everybody asks when this pandemic will end. So let's see what the condition now and then what we have done in Indonesia, and then from that condition, then we could predict when this epidemic will end. Okay, this is just the epidemic curve of the current COVID-19 in Indonesia. So there are two lines. The gray line is the reported one. So it is based on the date of reported cases. And the red line is the adjusted by the onset, because actually we need to adjust to the onset date to have a better or accurate epidemic curve. And if we see the curve right now, we haven't finished the first wave. So we are not talking about the second wave in Indonesia. And even the peak is not reached yet. So we don't know, is it the peak or not? We don't know, because we need more time to observe this one. Yes, you can see that there is already a decrease in this curve, but we don't know yet. Okay. Then if we do the measurement of effective reproductive number, this is the indicator that used by epidemiologists to understand the epidemic is control or not control. So if the effective reproductive number is below 1, so the epidemiologists usually will say that the epidemic is controlled, because 1 case is replaced by less than 1 cases. So then the curve will be going down and the epidemic is controlled. And this is the effective reproductive number of COVID-19 epidemic in Indonesia. So as we can see here, it is by yesterday, it is still 1.07. So it is still more than 1. And during this epidemic, it is never below 1. In some provinces, yes, some are controlled and then uncontrolled again, but Indonesia as a national is never below 1. So we cannot say that the epidemic is controlled. So the epidemic is not controlled yet. So then we see what is the main drivers of this epidemic. First, we can see here the population mobility, population crowding, and then the COVID-19. We can see here, April and May, April to June, this is what we call the PSBB period, or the large-scale social distancing policy. So here we can see that actually the growth of the curve is low. See, yeah. Then after the PSBB is loosened, not end, but loosened, then the cases is going up and up. And we see also in this curve, the relation between this orange line, this is the population mobility. This is show the change in population mobility compared to the before pandemic situation, based on the sample of the Facebook user. So this is from the Facebook UN site. So we could see here, when there is a holiday, this is the Idul Fitri, and then this is an Idul Adha, there will be increase in population mobility. As usual, this is not just general pattern. But during this COVID pandemic, the consequence is, you could see here, actually it's from here, in August, you could see the number of cases increase quickly. And even here, the last holiday. So this is the population mobility increase, and then the number of cases is increased significantly. So why? So actually we will see in the next slide. Before that, okay, let's see. This is if we do the statistical calculation. We did the correlation analysis. We could see clearly that there is a correlation between population mobility and then the number of cases, and it is follow the exponential function. So then why? Okay, let's see why it occurred. Actually, we already know that the non-pharmaceutical intervention, or it's called health protocol in Indonesia, could decrease the risk of COVID-19 infection. There is a paper in Lancet, meta-analysis show that actually washing hand, use mask, and then physical distancing is proven that have the effect in risk reduction. Then why? Because the government already said that we need to do this. Okay, let's see what happened here. So this is the result of the monitoring of how people adherence to the health protocol. There are many online survey. There are many self-response survey. But here, I prefer to use the observation. This is the observation by the volunteer about washing hand, wearing mask, and then physical distancing. Of course, this is not all over Indonesia. We still lack the volunteer in many provinces. But we can see here, actually, this is the last week, this week. So this is how the people adhere to the health protocol. And then if we look the trend here, I only look at the two indicators, use mask and physical distancing in the public places, because washing hand is difficult to monitor in the public places. It will depend on the availability of the hand washing facility. So if we look at this use mask and physical distancing, actually there is an increase, yeah, in September, but now it is decreasing right now, yeah, decreasing right now, and we only have in the public places about 40 to 50%. This is not enough to control the epidemic, because if we look at the published paper, we need at least 85 coverage of the health protocol to control the epidemic. So it means that it needs to be increased. Yeah. And then the second one is we already know that testing and tracing is important. I'm happy to understand that Ibu Nadia presentation that the tracing now is going better and better. Yeah. I hope it will be better than this figure, because if we look at the published paper, this is the impact of testing and tracing delay. D1 is the testing delay, D2 is the tracing delay. Testing delay is the delay between the onset or the swab and then the lab result. Tracing delay is delay between the positive confirmed in the cases and then the tracing started. So in Indonesia, we looked at the average of testing delay is about 3 days. So we look at this one. And how effective the tracing will depend on the tracing delay. Yeah. If the tracing delay is 3 days, so actually the effectiveness of testing and tracing is about 21% in reducing the effective reproductive number. So, and this is the condition that I understand in Indonesia. But actually, this is not the indicator that monitor frequently. So it is also difficult to get the figure. So this is what we are right now. Yeah. Yeah, this is also the same thing that actually this paper said that if the tracing delay is 3 days and more, the effect is very small in controlling the epidemic. So it is not just the tracing, but the tracing in the right time actually. And also the ratio, because at previous slide, the ratio should be 1 to 10, not 1 to 4 or 1 to 5. Yeah. So based on this condition, before I explain you about the model, then the hot issue, vaccine. There are great hope of vaccine. That's okay, no problem. Vaccine will help. But we need to understand that vaccine is not a magic bullet. It will not end the pandemic by itself. Why? Because actually, how vaccination control the epidemic is by creating the herd immunity. Yeah. And this is the simple calculation when the herd immunity will achieve. So here we can see, even if the vaccine, let's say 90% effective, we need to vaccinate 60% of the population, all Indonesia population, to create the herd immunity. It means that about 160 million. It will take time to achieve this coverage. This is if the vaccine effectiveness is 90%. And then we need to understand also effectiveness will less than efficacy, will less than seroconversion. Yeah, because what we got from the clinical trial is in ideal condition. It is efficacy. So if in the clinical trial we get 95%, 90%, the effectiveness will less than that. If we only get from seroconversion, say seroconversion is 95%, the effectiveness will less than the seroconversion. Yeah. So we need to understand which figure that the people talking about the vaccine. Yeah. So actually, vaccine will help, yes, but this is a long-term solution. And as WHO said also, it should combine with the non-pharmaceutical intervention, the health protocol, and then test, tracing, and isolation. Okay, given this condition, so I try to answer the question when this epidemic ends. Okay, so actually, what I did with my colleagues is to develop a model. What is the future of the COVID-19 epidemic in Indonesia, COVID-19 epidemic in Indonesia, given the current situation, the adherence to health protocol, and then the test, tracing, and isolation, and then vaccine, and with some scenario. So this is the model that we created for Bapenas. This is the orange one is the current condition. So if we are still with this current condition, yeah, the adherence, the adherence to health protocol, the test and tracing, we will follow the orange line. As you can see here, it will only ease or control the epidemic by 2022. So the next year we will still need to live with COVID. So if we have a better adherence and then the better test and tracing, we follow the green line. Of course, it will end at the same time. If it becomes worse, we cannot control the adherence of people for the health protocol, the crowding, the mobility, and then the tracing is going down, and then we will follow the red line. The end of the epidemic will about the same. What is different is the peak. Yeah, the peak is number of the estimated number of COVID-19 people with COVID-19. So if we follow the red line, we will have problem with our health facility. Our health facility will overwhelm with the COVID-19 cases. Yeah. So we need to keep orange or green. We hope that we can follow the green line, so the health facility can cope with the COVID patient. But the epidemic itself will be end by, our estimation is by 2020, not the 2021. So in 2021, we still need to live with COVID-19. All the program, all the health program should be adjusted with the condition that the COVID-19 is still there. Okay, I think that's what we try to answer the question when it will end. And of course, is the modeling, and then the modeling is a dynamic process. It could be changed with the changes of the situation. Back to you, moderator. Thank you.
Yeah. Thank you very much, Dr. Iwan. So we know that we should still hang on with the epidemic for COVID, yeah. So because the community is not comply and the tracing is still weak, so the cases is still increasing. Okay, thank you, Dr. Iwan. And the community only give me 100 minutes for this session. So we still have around 30 minutes for questions and answer. So the community, can you show me the questions? Or I should choose by myself? Okay, one question is for Ibu Nadia, Dr. Nadia. One question is, I read it in Indonesian, orang dengan anafilaksis yang tidak bisa disuntik vaksin, apakah ada solusi lain? Mengingat vaksin adalah jalan terakhir. Wah, ini kayaknya bukan jalan terakhir nih kalau ceritanya Dr. Iwan tadi ya. Oke, baik. Tapi Dr. Nadia, silakan menjawab pertanyaan ini.
Iya, mungkin izin Bu Rita saya jawab dalam bahasa Indonesia ya Bu.
Ya, silakan. Ada interpreternya, jangan khawatir Bu, bebas.
Siap. Baik, soalnya mendadak. Baik, mendadak. Baik, mungkin kalau orang dengan anafilaktik kemudian bagaimana mendapatkan vaksin, tentunya dalam pemberian vaksin kita juga memperhatikan apa yang menjadi masukan dari rekomendasi ITAGI. Dan di dalam rekomendasi ITAGI tentunya ada populasi-populasi yang tentunya menjadi populasi yang eksklusi daripada pemberian vaksin, sehingga memang kan vaksin ini tentunya sesuatu yang harusnya memberikan perlindungan. Jadi tapi ini belum dapat betul-betul kita pastikan karena kita juga masih menunggu hasil uji klinis dari Universitas Pajajaran dan nanti kemudian akan dikaji lebih lanjut dengan oleh tim ITAGI, termasuk juga mengenai perluasan sasaran daripada vaksinasi karena saat ini kan baru 18 sampai 59 tahun dan merupakan orang tanpa komorbid. Mungkin itu Bu Rita.
Iya, terima kasih Bu Nadia. Pertanyaan berikut ini dari anonymous attendee nih ya. Pertanyaannya adalah sebetulnya ini mungkin bisa dirangkum oleh Dr. Iwan ini ya. Jadi pertanyaannya adalah kenapa sih ya strategi pemerintah untuk memutus mata rantai penyebaran COVID ini kok nggak berjalan dengan baik ya? Kenapa bisa begitu? Nah, saya kira ini sebetulnya Dr. Iwan sudah menyampaikan, tapi silakan Dr. Iwan dirangkum kembali untuk memuaskan anonymous attendee ini. Silakan.
Ya, saya bahasa Indonesia ya jawabnya, karena tadi pertanyaan dalam bahasa Indonesia. Jadi kita sudah tahu sebetulnya bagaimana cara untuk mengurangi risiko infeksi COVID-19 ini ya, dan sudah dijalankan sebetulnya oleh pemerintah. Tapi memang betul belum efektif. Pertanyaannya apa? Yang pertama untuk protokol kesehatan ya. Kalau untuk protokol kesehatan, itu kan memang kita mengharapkan dari masyarakat untuk taat terhadap protokol kesehatan. Nah, kita tahu bahwa orang itu akan melakukan apa yang diminta kalau dia punya persepsi risiko yang baik. Artinya dia merasa bahwa dia itu punya risiko untuk tertular atau menularkan COVID-19, sehingga dia mau melakukan protokol kesehatannya. Nah, itu dari beberapa survei menunjukkan bahwa persepsi risiko belum baik. Nah, apakah salah masyarakat? Bukan juga, gitu kan? Karena ini kan sebetulnya tugas kita bersama bagaimana kita mengkomunikasikan risiko itu ke masyarakat ya. Tentunya komunikasi buat teman-teman yang ahli komunikasi lebih ngerti bahwa itu bukan sekedar ngomong atau bukan sekedar poster gitu kan. Itu mesti ada contoh juga karena kita juga masih lihat kan contoh pejabat-pejabat masih pakai masker di leher, kan? Kemudian rapat nggak pakai masker. Sebetulnya saya pernah bilang, emang kalau rapat nggak pakai masker kenapa? Nggak apa-apa toh, suaranya masih kedengaran. Ya nggak bagus sedikit, tapi kita bukan mau nyanyi, gitu kan? Nah, itu kan, itu contohnya masih kurang gitu ya. Nah, kemudian tes tracing dan isolasi. Itu tadi Bu Nadia sudah menjelaskan itu sudah ada perbaikan ya, sudah ke arah lebih baik, memang belum mencapai target yang diharapkan ya. Padahal itu cukup efektif untuk mengurangi penyebaran COVID-19. Nah, ditambah kerumunan tadi ya, sebetulnya kerumunan itu kalau semua melakukan protokol kesehatan dengan konsisten, tidak akan menambah kasus banyak. Tapi kalau masih menambah kasus banyak seperti analisis yang kami lakukan, itu menandakan bahwa ya itu belum dilaksanakan oleh orang-orang yang bepergian atau yang berkerumun tersebut. Gitu. Itu dari saya, Bu.
Iya, terima kasih Dr. Iwan. Ya, tadi juga ada informasi yang dari Prof. Wiku ya, bahwa institusi behaviors yaitu jadi perusahaan-perusahaan itu belum menerapkan protokolnya dengan baik. 15% cuma. Nah, itu menarik juga itu. Itu baik di level mana ya? Mungkin di level misalkan pasar itu lebih parah lagi. Ya, sehingga itu menjadi jawaban juga kenapa COVID ini masih naik terus. Oke. Nah, selanjutnya dari Ayuda Ramadan untuk Prof. Wiku, ya, pertanyaannya adalah dalam mendapatkan informasi kalau seorang tersebut positif atau negatif, itu kan harus melalui tes PCR. Dan itu pasti membutuhkan biaya. Dan pasti masyarakat ogah dalam membayar biaya tersebut. Begitu, karena tidak mahal, tidak murah ya. Nah, bagaimana dan apa upaya pemerintah atau tim Satgas dalam menyediakan tes PCR atau swab gratis? Saya kira ini perlu disampaikan nih Prof. Wiku. Silakan Prof. Wiku.
Ya, baik. Jadi sebenarnya tes PCR itu kan digunakan untuk diagnostik ya. Kalau untuk screening menggunakan rapid test. Jadi kalau orang sudah memiliki gejala dan datang ke fasilitas kesehatan, diduga ini adalah COVID, dilakukan swab test untuk tes PCR, itu gratis, dibiayai oleh pemerintah. Jadi begitu. Tapi kalau kita tidak punya indikasi apapun, atau kita minta untuk melakukan tes PCR, ya harus bayar sendiri. Jadi clear saja, kalau memang ada masalah, ya pasti dibiayai oleh pemerintah. Demikian.
Ya, terima kasih Prof. Wiku. Pertanyaan berikutnya ini untuk Ibu Nadia. Ya, bulan ini vaksin COVID sudah datang ke Indonesia. Apakah vaksin tersebut sudah efektif dan amankah untuk segala umur? Dan ada berita bahwa ada risiko dalam penggunaan vaksin tersebut seperti kecacatan atau terkena penyakit tertentu. Apakah ini benar risiko yang ditimbulkan? Silakan Ibu Dr. Nadia.
Ya, baik, terima kasih Dr. Rita. Jadi pada prinsipnya seperti saya sudah sampaikan sebelumnya bahwa kita masih menunggu persetujuan emergency use authorization dari Badan POM dan tentunya laporan akhir dari uji klinis yang dilaksanakan bersama Universitas Pajajaran. Kemudian tentunya yang terkait apa yang sudah direkomendasikan secara general dari ITAGI bahwa vaksinasi akan diprioritaskan kepada tenaga kesehatan dan garda terdepan lainnya seperti pemberi pelayanan publik yang kemudian ini adalah pada usia rentang 18 sampai 59 tahun tanpa komorbid. Jadi kalau tadi ada pertanyaannya untuk anak tentunya ini tidak masuk sampai saat ini. Dan yang kedua, yakinlah bahwa pemerintah dalam melakukan upaya vaksinasi nasional akan mengkaji, mempertimbangkan banyak hal dan tentunya berkoordinasi dan mendengarkan tentunya para ahli terkait pilihan vaksin dan vaksinasi yang akan kita lakukan. Tentunya Pak Menteri Kesehatan sendiri sudah memberikan jaminan untuk vaksin yang akan dipilih adalah vaksin yang aman, bermutu, memiliki efikasi dan tentunya efektivitas. Sampai mungkin tadi yang disampaikan oleh Bapak Iwan sampai akan menimbulkan herd immunity yang diharapkan. Tetapi tentu saya sangat setuju bahwa vaksin bukan segalanya. Yang justru kita ingin selalu dorong adalah 3M, semakin diperkuat kembali supaya nanti upaya vaksinasi ini tentunya akan memberikan hasil yang lebih baik kalau kemudian ditunjang dengan penerapan protokol 3M yang masih sangat dilaksanakan dan dipatuhi di dalam masyarakat. Sekian Bu Rita.
Ya, terima kasih Dr. Nadia. Selanjutnya ini ada pertanyaan. Ini untuk Dr. Iwan, tetapi mungkin Dr. Nadia juga bisa menjawabnya. Ini dari Dr. Vira Dolores. Pertanyaannya adalah, sampai kapan validasi laboratorium di bandara sebentar, aduh ini kok jadi hilang pertanyaannya. Oke, saya ganti pertanyaan yang berikutnya ya untuk Dr. Iwan. Interesting and informative presentations, Doc. Thanks. From your presentations, COVID-19 vaccines will be effective if followed by herd immunity 16%. There are many types of COVID-19 as in Europe, US, China, etc. So how important the COVID-19 vaccines to people, especially in Indonesia? Are the vaccine will cover all the COVID-19 virus type? Silakan Dr. Iwan dan mungkin Dr. Nadia, silakan.
Iya.
Atau Prof. tidak bisa.
Iya, mungkin mesti juga yang lain menjawab. Ya, saya menjawab dari yang saya ketahui. Jadi betul kalau strain virusnya berbeda, mungkin efektivitas vaksinnya berbeda. Saat ini memang belum tahu ya, karena kita juga tahu bahwa ini kan virus yang baru. Nah, jadi memang paling ideal adalah digunakan vaksin yang diuji coba di Indonesia gitu kan, pada orang Indonesia pada strain virus yang ada di Indonesia. Ya, kalau itu kan lebih mendekati apa yang akan terjadi di Indonesia ini. Nah, dan tentunya tadi Dr. Nadia juga sudah mengatakan bahwa pastinya sebelum diberikan ini kan perlu persetujuan Badan POM, ya Badan POM yang melakukan evaluasi untuk keamanan dan efektivitasnya. Dari saya itu tanggapan saya. Nanti yang lain mohon menambahkan.
Silakan, Dr. Nadia, bisa menambahkan.
Ya, sebenarnya terkait hal ini kami sangat memperhatikan apa yang menjadi kajian daripada ITAGI. Dan di dalam ITAGI itu sudah disebutkan juga bahwa ada 6 sebenarnya vaksin yang bisa digunakan di Indonesia. Mungkin data-data perkembangan terkait vaksin maupun data epidemiologisnya mungkin masih menunggu hal-hal selanjutnya. Tetapi pada prinsipnya berdasarkan dari kajian literatur oleh ITAGI, 6 jenis vaksin yang tentunya berbeda-beda, ada yang inactivated, ada yang mRNA, dan ada yang bagian jenisnya yang lain itu juga merupakan yang dirasakan bisa digunakan untuk di Indonesia ini. Itu mungkin respon saya, Dr. Rita. Mungkin pembicara lain bisa menambahkan, mungkin. Prof. Viku juga.
Ada mau menambahkan?
Sebenarnya sudah komplit sih tadi penjelasannya. Jadi pada prinsipnya tunggu saja hasil.
Ya.
Akan menjelaskan bisa atau tidak, punya masalah studinya seperti apa. Jadi kita tidak berani ini virusnya cocok apa dan seterusnya dari studi itu, dan pakar yang akan mengatakan bahwa itu tepat. Demikian, terima kasih.
Iya, jadi prinsipnya pemerintah tidak mungkin akan memberikan vaksin kalau belum diyakini aman, begitu ya? Itu kita harus percaya pada hal tersebut, begitu. Oke, ini masih ada lagi tentang vaksin. Ini rupanya vaksin ini banyak pertanyaannya. Ya. Jadi ini pertanyaan praktis dari Bila ya, pada Dr. Nadia. Kalau sudah pernah terpapar positif COVID ya, apakah masih perlu divaksinasi? Gitu. Dan apakah efek imunisasi itu akan sama atau tidak dengan yang belum dan sudah terpapar? Silakan Ibu Nadia. Polisinya gimana itu kalau sudah terpapar? Apakah disikat juga di vaksin?
Jadi kalau kita melihat vaksin influenza yang lain, Dr. Rita, setiap vaksin influenza rasanya walaupun sudah terinfeksi tetap mendapatkan vaksin influenza ya. Dan sampai saat ini karena kita ingin meyakinkan dan ini adalah program imunisasi nasional, artinya vaksinasi nasional, dan di dalam kriteria yang dikeluarkan oleh ITAGI itu tidak mengeksklusikan kriteria untuk yang sudah pernah positif COVID. Jadi dalam hal ini tentunya nanti yang pernah punya riwayat positif COVID pun kalau memang mendapatkan etiket untuk mendapatkan vaksin juga akan mendapatkan vaksin seperti itu.
Oke, terima kasih. Nah, kalau ini pertanyaannya ini tidak terkait vaksin ya. Tetapi apakah betul pilkada tidak ada korelasinya dengan kenaikan angka kasus COVID-19? Nah, silakan Dr. Iwan dan mungkin Prof. Viku, silakan.
Atau Dr. Bria, Bu Brian mungkin bisa juga.
Oh, Bu Brian. Oke, boleh Bu Brian silakan. Tentang
belum tahu kan pilkadanya baru kemarin ya. sama seperti waktu liburan panjang kan. Walaupun kita sudah punya asumsi ya, maksudnya prediksi. Prediksinya apa? Kembali lagi ke protokol kan, di mana di sana terjadi kerumunan, di mana orang tidak comply terhadap penggunaan masker, cuci tangan, itu kita sudah prediksi apa yang akan terjadi. Nah, ini juga begitu. Nah, tapi apakah korelasinya iya atau enggaknya ya nanti 2 weeks after kita akan melihat. Berdoa sih mudah-mudahan sih.
Mudah-mudahan enggak.
Mudah-mudahan enggak begitu ya. Ya itu saja yang bisa saya respon kalau terkait dengan pilkada. Tapi Bu Rita kalau boleh saya merespon sedikit. Tadi ada satu pertanyaan yang menarik yang di atas.
Boleh silakan.
Ya, terkait karena ini sering sekali ditanyakan ya. Terkait tadi kalau nggak salah pertanyaannya adalah gimana sih strategi pemerintah kok kenapa penularan masih terjadi terus gitu kan? Jadi ada pertanyaan seperti itu. Nah, kalau saya melihat kan gini, ini kan kita tuh berproses ya, pemerintah ini berproses. Kalau dibandingkan dari yang awal sekali sampai sekarang, itu ya improve-nya ada dan signifikan banget kalau menurut saya. Bahkan dari sisi kebijakan tuh luar biasa kita. Jadi bagi saya kalau strategi pemerintah itu mestinya kita tidak ada pertanyaan untuk itu. Tetapi lagi-lagi pada saat kita berbicara soal memutus mata rantai penularan, ini kan ada unsur perilakunya di dalamnya, apalagi perubahan perilaku. Ini Bu Rita kan malah pakarnya nih untuk perubahan perilaku. Nah kalau perubahan perilaku, pengalaman kita kan membuktikan nggak ada perubahan perilaku yang terjadinya instan. Itu perlu proses yang panjang. Sebetulnya ada faktor di sini, ada dua faktor yang bisa mendorong perubahan perilaku terjadi dengan cepat, yaitu severity, keparahan dari penyakit ini, dan kerentanan, bagaimana orang merasa rentan untuk tertular. Harusnya ini sebagai pendorong ya, pendorong yang bisa mendorong seseorang untuk terpaksa berubah perilaku. Masalahnya adalah, walaupun kita tahu nih banyak orang setiap hari ada yang meninggal dan seterusnya dan digambarkan di media di mana-mana begitu luar biasanya. Tetapi faktanya adalah sebetulnya yang betul-betul menjadi parah dari sekian banyak kasus itu kan nggak secara persentase ya, walaupun secara klinikal satu saja itu matters buat kita. Tapi kalau dilihat secara besaran, mungkin hanya 20%-an yang menjadi parah, dan yang meninggal tergantung umur ya, semakin tua itu semakin tinggi. Tapi itu kurang lebih 3%. Sebagian besar itu gejalanya ringan begitu, dan dia masih bisa jalan-jalan, bahkan mungkin bukan tidak bergejala. Sekarang kan ada gejala yang sangat khas itu anosmia, yang menurut saya tidak mudah orang bisa mengenali itu. Dan pada beberapa kasus dua hari gejala anosmia kemudian hilang. Jadi dia tidak sadar kalau dia itu sudah sebetulnya sudah terinfeksi COVID-19. Nah, yang 80% ini membuat severity dan kerentanan itu tidak ada, sehingga tidak kemudian paksaan seseorang untuk berubah perilaku itu menjadi rendah. Nah, itu kita tidak menyalahkan pemerintah, tidak menyalahkan rakyat gitu kan ya. Tetapi juga tidak mengatakan bahwa strategi pemerintah itu salah, tetapi ini memang ada sesuatu yang terjadi, ya faktanya seperti itu. Sehingga kalau kembali ke topik yang saya sampaikan tadi, ya memang ini memang harus kolaborasi, semuanya harus berkontribusi semaksimal mungkin yang kita bisa lakukan. Termasuk nanti tuh Dr. Iwan. Pak Iwan, kalau kita bicara tentang herd immunity, nah ini kan PR kita adalah secara komunikasi ini bagaimana caranya supaya masyarakat kemudian mau menerima vaksin ini. Itu yang harus kita dorong. Karena kita nggak bisa cover 100%. Kalau herd immunity tidak tercapai, yang 40% itu, atau kalau desain di roadmap kita kan 25% ya, yang 25% itu yang karena alasan tertentu memang tidak mungkin diberikan vaksinasi, dia kan hanya bisa terlindungi dari yang 75%. Jadi PR kita sekarang adalah komunikasi, membuat orang kemudian percaya bahwa ini penting begitu dan mau melakukan imunisasi, tidak hanya untuk protect themselves but also to protect others that for some reason cannot be vaccinated. Mungkin itu Bu Rita yang ingin saya sampaikan.
Ya. Terima kasih Bu Brian. Ini selanjutnya ini pertanyaan untuk Bu Brian ini ya dari Adri Setiawan ya. Bagaimana Ibu kami selaku tenaga kesehatan memberikan pengertian kepada masyarakat yang makin hari mempercayai bahwa COVID-19 adalah teori konspirasi. Hal ini berefek pada keundangan masyarakat untuk menerapkan protokol kesehatan. Ayo, holistiknya gimana nih, Dr. Brian?
saya balik lagi. Ini kan kita ke ilmiah nih ya. Di seminar ini kan saya lihat kan akademi ini, dan pertanyaannya juga banyak juga dari universitas. I think I have to challenge the health promotion practitioner gitu dan akademisi untuk memikirkan ini nih. Ini kan mengubah mindset orang, dan kita nggak bisa paksakan loh. Di era sekarang itu beda banget dengan zaman kita dulu kuliah. Dulu dokter puskesmas duduk nih, orang datang, kita ngomong A, orang nurut.
Yeah.
Kita mahasiswa datang ke kampus, dosennya mau ngomong A, kita semuanya nurut. Sekarang orang bisa informasi terbuka luas, dosen bisa ngomong A, tetapi sosial media berbicara lain, dan itu tidak bisa dihalangi. Tapi yang saya pelajari, that's actually the typical of millennial, the generasi Y gitu loh. Generasi Y itu memang dia pengen akses informasi seluas-luasnya, dan sudah dalam naturalnya mereka untuk sangat mudah untuk ngikutin perkembangan ilmu pengetahuan teknologi informasi di era digital ini gitu. Jadi kita nggak bisa salahkan mereka juga begitu ya. Jadi kalau ditanya gimana caranya, ya dokternya mungkin juga harus banyak baca juga kali ya, harus berusaha, kan kita sekolah kita lama begitu kan, walaupun sebagian dari dokter ada yang sudah dari generasi Y, tetapi lamanya sekolah tuh membuat kita, karena anak saya masuk generasi Y juga nih, dokter juga nih, tapi dia nggak kayak milenial pada umumnya karena mungkin sekolah kedokteran kan kita indoktrinasinya besar tuh ya. Jadi harus banyak membaca dan berusaha mengikuti ini general population ini, pemahamannya seperti apa. Kita ikuti cara berpikir mereka. Kalau banyak orang akses informasi lewat social media, so we have to disseminate the information also through the social media gitu. Jadi mengikuti tren yang terjadi. It cannot answer all the question gitu, karena memang ini susah. So back again, actually I challenge the health promoter to think about this. Thank you.
Oke, terima kasih Dr. Brian. Baik, saya kira ini sudah cukup melengkapi pertanyaan-pertanyaan. Ada beberapa yang sama, dan saya kira kita bisa akhiri diskusi dan tanya jawab ini. Terima kasih banyak kepada thank you very much for the four speakers, yeah, and I hope your presentations will give a lot of new information, new perspective, yeah, for us, yeah, on how to handle the COVID-19, yeah, and thank you very much, and I will give back the sessions to the MC, Ibu Farida. Thank you.
Thank you, Dr. Rita, for leading the first session into an interesting discussion. Professor Wiku Bakti, Dr. Siti Nadia Tarmizi, Dr. Brian Sri Prahastuti, and Dr. Iwan Aryawan, special appreciation from us to all of you. Now that we have learned a lot about this pandemic management in Indonesia, we will shortly move to a broader scope to learn its management in Asia. But before that, as you probably need to relax your tight muscles a little bit to ease the blood flow to your brain, now don't be hesitate, just stand up and do the stretching while watching the video of our sponsors. But do not leave the screen, please, because after the video, we are going to give notice about attendance link on screen and chat column. Thank you.
Waktu itu nggak ada yang jual, karena waktu adalah anugerah yang harus disyukuri. Harus bisa dimanfaatkan sepenuhnya. Apalagi untuk ia yang telah memberi waktu seutuhnya. Waktu memang tak ternilai. Untuk kita yang tak mau terus bermimpi. Untuk kita yang menerima tantangan di depan. Jangan biarkan waktu itu terbuang untuk momen yang tak bisa diulang. Jadikan waktu itu lebih berkah. Dengan Mandiri Syariah Mobile, buka rekening sekarang bisa online. Lebih mudah, lebih berkah. Waktu itu gak ada yang jual, karena waktu adalah anugerah yang harus disyukuri. Harus bisa dimanfaatkan sepenuhnya. Apalagi untuk ia yang telah memberi waktu seutuhnya. Waktu memang tak ternilai. Untuk kita yang tak mau terus bermimpi. Untuk kita yang menerima tantangan di depan. Jangan biarkan waktu itu terbuang untuk momen yang tak bisa diulang. Jadikan waktu itu lebih berkah. Dengan Mandiri Syariah Mobile, buka rekening sekarang bisa online. Lebih mudah, lebih berkah.
Semua bisa bilang mudah. Itu bisa, itu juga bisa. Tapi kalau mudah sekaligus berkah? Kayak tinggal scan pas bayar kopi. Dan klik buat berbagi. Kelihatannya sih lagi asik chattingan. Taunya lagi husu baca Al-Quran. Kirain cuma seneng belanja online. Nyatanya seneng memberi juga. Pas lagi asik kerja berjam-jam, tetap ingat sama kewajiban. Semua bisa di Mandiri Syariah Mobile. Transaksi lebih mudah, berbagi makin berkah. Buka rekeningnya bisa online.
Hello again, hope you're already fresh right now. Do not forget, you can find the attendance link at the chat column if you're using Zoom or at the live chat if you are using YouTube. So please check those so you can fill in the attendance. So we are going to go ahead to the next session, the second session, with the title of Pandemic Management in Asia. That will give us the insight on how other countries in Asia deal with this pandemic. This session will be moderated by Doctor of Medicine Agustin Kusumayati, Master of Science, PhD. Dr. Agustin is the elected President of Asia Pacific Academic Consortium for Public Health and the Chairman of Indonesian Public Health Education Institute Network. Dr. Agustin, please the moderator for this session. Time and screen are yours.
Thank you. Good afternoon, everyone. It's really a pleasure to have the opportunity to facilitate this second session. Early this week, the Asia Pacific Academic Consortium of Public Health held its 2020 virtual conference. Many of its sessions are discussed about things related to COVID-19. We discussed, for example, experience of many countries that doing very well in dealing with COVID-19, the research agenda, etc. And then during that conference, frankly speaking, I was a bit upset because for the 2 days conference, none of Indonesian public health practitioners, none of Indonesian public health scientists were invited to speak. Maybe because we are not doing well in dealing with COVID-19. So the webinar this time is really a good opportunity to know how actually Indonesia do in facing the pandemic. So during the previous sessions, we have heard 3 speakers from quote-unquote government, 3 speakers from quote-unquote government institutions, and also the Minister of Health itself explaining what we have done so far in facing this pandemic. And then the last speaker in the previous sessions, Dr. Iwan Aryawan from the Faculty of Public Health, Universitas Indonesia, give us the answer why Indonesia is not doing well yet with the COVID pandemic. So I'm glad that during the first sessions, all of the resource persons that we invited from various institutions in Asians are also joining the sessions. So maybe they can now understand what actually have been done by Indonesians and why we are still not be able to control the pandemic in Indonesia. We will have in these sessions 4 resource persons. We will have Dr. Pem Namgil from the WHO Southeast Asia region, and Professor Yanto Chandra from Hong Kong Polytechnic University, Dr. Pramon Viwatanakulvanit from the College of Public Health Sciences, Chulalongkorn University, and my dear friend, Professor Betty Yawen Chiu from the College of Public Health, Taipei Medical University. Let's now hear from them their experience in dealing with COVID-19 pandemic in their countries so that we, Indonesians especially, can learn from them. So I give the first, for the first speaker, I will invite Dr. Pem Namgil from the WHO Southeast Asia region to give his materials to all of us. So Dr. Namgil, the time and the screens is yours. You have 15%, 15 minutes to present.
Yeah, thank you, Madam Moderator. Can you hear me?
Yes, yes, it's clear.
Okay. So can I request to please put up the slides?
Panitia sudah diberi apa namanya? I think you have the access to use the screen share. Okay.
All right.
We see already. Yeah.
Yeah, I saw. So thank you, Madam Moderator, and I would like to thank Professor Sabarina and Professor Kunchore of the university for giving me this opportunity to talk to you today. In this 15 minutes, what I'll try to give you is a relatively high-level, broader perspective on what this pandemic is, what it has done, and how we should be looking at as we go forward beyond the pandemic. Next slide, please. Yeah, so this is just the outline. So I shall talk a little bit about the pandemic itself. And of course, linked to the global response is what WHO advises and the various actions that WHO has taken to support the countries. Then I will talk a little bit about some of the examples by countries, but I'm very happy that there are many country presenters here, so we'll learn in depth more from them because I won't be able to touch in great detail. And then I'll talk a little bit about pandemic impact, particularly on health and health workers, and then what lessons we could learn from that, and then going forward, what we can do to build better for the future. So next, please. So, I mean, this is just a screenshot from the reporting of the number of cases. And as you can see, this was yesterday at 4 p.m., which is about 69 million globally and about 1.5 million. And then deaths. And then this morning, when you look at it, you see it's already crossed 71 million worldwide. So it's a relatively fast-moving pandemic, still gaining momentum rather than seeing it going down. So overall, globally, we are nowhere to seeing an end to this pandemic. And I think especially in Northern Europe and then in North America, you see the pandemic accelerating much more now than when it started. Next, please. Just very briefly, as you know, it was in January that the WHO received the first report of some unknown respiratory infection, clusters of it in the Chinese city of Wuhan. And then WHO met, called its international head regulatory committee members to discuss about that, to declare it as a public health event of international relevance. And then eventually in March, WHO declared it as a pandemic. Next, please. Now, in terms of the global management of the pandemic, because for the global control and prevention of the pandemic, it was necessary first to characterize the nature of the transmission of the pathogen as to calibrate the response appropriately, because this is a new outbreak. This is a new disease, and we do not know about how it behaves or how it will behave. And therefore, WHO has to look at how to calibrate or how to characterize the outbreak in order to guide the countries to do that. And also because this is a new pathogen that has come out, it was very important that research and development, whether it is for tools, whether it is for drugs or vaccines, are critical if the world is going to be able to control this pandemic successfully. So WHO very quickly got to work on these. Next, please. Next, yes. So what if you look at in terms of characterizing the outbreak to guide countries how to respond? So the outbreak broadly is or grouped or characterized into 4. So 1, where there are no cases. 2, where there are a few few cases, and then the third one is where there are small clusters, and then eventually, of course, when those clusters expand and reach into the whole of the community or larger groups of the community, then you have a community outbreak. And it was important to do this in order to allow countries or guide countries to make their response appropriate to these groups. But of course, what we have seen is that countries do not or did not necessarily follow exactly the epidemiological response in terms of the characterized outbreak. partly also because it was difficult for countries to make that sort of decision for various other reasons. And it was difficult to obtain the required data from the countries sometimes to be able for WHO or technical agencies to be able to make a evidence-based guess, I would say, or a decision on how we go forward. Nevertheless, WHO issued as early as, as it was required, guidelines to countries on how to manage COVID, and then also to help countries in developing their pandemic response, not only response, but also to look at preparedness, because this was something that was going to go on. So that therefore you see all these various guidelines that WHO issued initially, the pandemic COVID strategy, control strategy, and then the SPRP, so-called, which basically looks at essentially how to control this, how to suppress the outbreak, how to reduce mortality, and then to help develop the necessary tools, drugs, and vaccines that are required. And in the previous presentation, you have heard discussions around the vaccines and other tools that were being developed or developed to control this pandemic. Next, please. So, in terms of so within these broad guidelines that WHO issued, in terms of how countries responded, when you look at it broadly, what I would say is that the response of the countries are tailored around the three basic measures. That is primarily to test any suspect cases, treat those that are positive, and then trace those that may have come in contact with any positive cases, sometimes referred to as the 3 T's as the fundamentals of dealing with this COVID. And of course, and then within that, there are a host of actions, and in the previous presentations, people covered, wearing a mask, ensuring appropriate social distancing, and ensuring hygiene, particularly hand washing and others. The overall country response, if you were to look at globally how the countries have responded to this various outbreak, I would again say that you have a wide range of response. So they span from very strict and total lockdowns with aggressive test, treat, and trace protocols in place, and there are many countries that have done that, and then there are some countries that sort of did a graded lockdown. That means they were more focused into local outbreaks and locking down those so that the infection did not have a wider spread. And then ensuring again the basic principles of the test, treat, and trace. And then we have groups of countries which neither did lockdowns nor had any clear policy really or a strategy on how to control or prevent this outbreak. Next, please. So I just to give a few examples, if you look at it, I mean, there are many countries that can fall into any of the categories. Overall, I would say globally, I think most countries of the world really took this pandemic very seriously right from the beginning, tried to put in whatever measures that they could within the capacities that the countries have. But when you look at it now, almost a year after the first report of the pandemic, and when you look at the landscape of how countries have responded and what results it has yielded, clearly there are some countries that have done very well, I would say, in the prevention and control of this pandemic. And I list a few countries. Now, in our region, in the Southeast Asia region of WHO, we have Thailand, we have Sri Lanka, we have Bhutan, that are real examples of good public health practice, examples of good public health infrastructure in place, and examples of where the government and the whole of society and got together to address this issue and did very well. So we have many countries in our region, I think, that have done really well. Globally, there are also some countries that either for various reasons did not think that it was important to sort of address this, or for whatever reason did not want to address this. And we have a few countries, and some you see for example, a case in Belarus, which I think is a very interesting case. And I always say that we would like to look at this in future to see what lessons we can learn. As you know, at the start of the pandemic, President Lukashenko actually joked, saying that the cure for pandemic was to drink vodka and go for a hot bath, you know. And as far as I know, the government has never really put in any protocol or measures to control the pandemic as such. And likewise, we have other countries, and in these countries, you see the number of cases, if they are at least testing and reporting, even if they're not doing any control, and the number of deaths and the overwhelming of the hospital setup by the number of cases that land up in the hospital. So clearly, not doing enough is not really the answer. And then there are a host of other countries that would fall anywhere in between these two categories, where they have tried, where they have done quite well, but in some aspects haven't done very well, and in other aspects they have done well. So one can argue on these things, but I thought I'll just as an illustration of a sort of a very macro, high level look at how we can look at the experiences of different countries on that. Next, please. Now, in terms of the WHO's, I think in this pandemic, WHO has really been at the forefront in every way possible. And WHO, I think, has been, I would say, I'm not saying only because I'm WHO, but I think WHO has been successful in really bringing together all stakeholders, all international partners, the national governments, and people on the ground together in solidarity with each other in order to address this. And just to give an example, when WHO published the SPRP, in order to support that, the projected fund requirement to support countries to do this was about $1.7 billion. And when WHO went out and asked for it, we were very happy that we were able to actually raise 1.5 billion of the estimated 1.7 billion. So this was really dramatic, and this is because of the success in the partnership that WHO was able to foster and bring countries, donors, and partners together to do this. Because it was very important that countries needed the support to be able to deal with this, and it is all countries needed that. And of course, countries that are economically better off could manage it with their own resources, but largely the money that WHO has raised has gone to those countries. And in our region, all countries received part of the money that WHO raised on this. And I think this WHO success in fundraising has been really fundamental to the success, both in terms of the logistics of supplies, ensuring that the critical supplies were available, the research and development agenda, whether it is diagnostic tests or whether it is pushing the global community towards developing new vaccines, and then the drugs that were used for COVID treatment. So there has been an extremely vast amount of work in each of these, and each of these by itself is a subject. But I just wanted to mention that I think this pandemic presented an unprecedented opportunity for WHO to really garner the support of all partners in solidarity to address this pandemic, which every country is not spared of. So next, please. Now, in terms of the impact of this COVID, I'm sure many experts have already talked, I'm sure, in this during this seminar, and would have presented to you different aspects, economic aspect, economic impact, social impact. There are all kinds of things. There is no aspect of a country's system, and there is no aspect of our way of life that have not been impacted by this pandemic, whether it is the way we travel, whether it is the way we eat, whether it is the way we entertain, or whether it is the way we work. I think everything has been turned upside down, and therefore this pandemic has had profound impact on literally everything that we do. And each of those sectors or areas deserve in itself a very, I would say, long and detailed discussions on that. But today I would very briefly focus on two things. One, I'm going to talk a little bit about the impact on health services, particularly focusing on health workforce, because that is what is not talked that much. And then later on we'll talk. And then later on we'll talk a little bit. Next slide, please. Yeah. So surprisingly, we would have thought that given the health systems that are in place, and given that most countries felt that their health system, both in developing as well as developed countries, thought that we have a health system that was doing okay. But this pandemic showed that our health systems are not capable of rising to the needs of a situation such as this pandemic demanded. Even in the most advanced countries, whether you're talking in Europe, Italy, France, or the UK, or the US, you see that the current model of health system is not sufficient and not in many ways appropriate to deal with emergencies such as a pandemic. And because of that, it has got negative, many unexpected consequences on that. For example, WHO carried out a quick assessment of the impact of COVID-19 on essential health services through a key informant survey among Ministry of Health officials in the 5 WHO regions between May and June 2020 by using a tracer indicators of 25 essential health services. And questionnaires were sent out to about 159 countries, and about 105 countries responded on that. And then when you look at that, and I put these graphs here, when you look at that, there were widespread disruptions in essential services globally. And more than 90% of the countries experienced at least some disruption, with greater disruptions reported in low and middle income countries than in high income countries, obviously because of capacity issues. And if you look on the right graph, the most frequently disrupted services included immunization services, facility-based services, for example, people not coming to hospital and health centers, not because they cannot come or because there are no service. It is because people were afraid, and the whole idea of social distancing and keeping that, everybody was aware of that, and in some ways, even if services were there, people did not come to accept it. And then family planning and contraception, treatment for mental health, cancer, related services, antenatal care and services. So there were a host of impact that this COVID had on the essential health services. So not only we had to deal with the pandemic itself, but suddenly we have to deal with ensuring the revival, if not the maintenance, of the essential health services, because in spite of the COVID, people become sick for all those, and those with chronic conditions require the attention and services and treatment that they require, which was not happening. And this I think was a very important aspects of what the pandemic did to the health systems as such. Next, please. Yeah, so again, just listing out. So in order to guide the countries on how to kick back or kickstart the maintenance of the essential services, WHO quickly put together a guideline on that, and I put the cover page of this on the right side of the slide here. So to guide the countries to make sure that countries are looking at this, at least to make sure that it is not falling through the cracks. Because while we have to deal with the COVID, we also have to ensure that we deal with the routine services that are required by the population of our countries. Next, please. Next. Yes. So now one thing that you do not hear very frequently, and I want to highlight this a little bit more, is the impact of COVID on health workers. Everybody applauds the health workers, and we are very grateful to our frontline health workers, the doctors, the nurses, the technicians, the people who work in the hospitals and healthcare facilities, giving service to that. But it has not been without cost to these people. Health workers are impacted by being increased risk of transmission because of the long working hours, having to work in environment where there are many cases, and obviously the risk of infection is very high. Health workers had to face extraordinary levels of psychological stress, both living in constant fear of disease, getting the disease, and then of social stigmatization, even violence against health workers, harassment, ostracism. You probably have read cases where health worker comes back from the hospital and finds that the landlord, owner of the house, have locked the house and would not allow the health worker to come back to his or her apartment because they were afraid that he or she would be bringing the disease home. And then, of course, the verbal harassment and others, and then even discrimination against. So there are studies which were published which looked at this and shows an increased degree of these, in health workers. Globally, health workers represent less than 3% of the population, but an analysis of health worker information from 83 countries, from the primarily European and American countries, estimate that around 14% of COVID-19 cases reported to WHO are identified as occurring in health workers, indicating thus a clear overrepresentation of cases among health workers. A study published in The Lancet among about 2.135 million people in the UK and USA using the COVID-19 symptom study app between March and April noted that frontline healthcare workers had at least a 3-fold increased risk of reporting a COVID-19 test and predicted COVID-19 infection compared with general population, even after accounting for other factors. According to a study by Amnesty International in August, it was estimated that more than 7,000 health workers have died around the world due to COVID-19. Locally, for example, here in where we are in India, an analysis by the Indian Medical Association shows that out of 515 deaths among there were 515 deaths among 2,500 doctors that were infected with this. And when they looked at the case fatality rate of this calculated, it was 16.7% among the doctors, which is 10 times or more than what it is in the general population. So clearly, the health workers are at great risk during this, but we don't talk much, and unfortunately, we don't get much data on these. And I'm sure in Indonesia also, you probably have the data on this, but I think the last time I tried to search for this from public domain and reported, I think that there was a report of more than 70 doctors having died due to COVID. Probably there are many more. So what I want to emphasize is that this pandemic, and of course, I suppose all other infectious diseases would do the same, but we really need to pay attention to the care of our health workers, the frontline health workers, because if they fall, then we are all vulnerable to the effect of this pandemic. But sometimes we often forget because everybody expects it, because everybody expects and thinks that we should be there. It is sort of a given, and don't realize the impact that it has on that. Next, please. So very quickly, given that I don't have much time, I want to summarize a few lessons. Now, there are many lessons that can be learned from this pandemic. And if you search the literature, there are already published papers which highlight what lessons can be learned. And then from each country, you can look at what lessons you can learn. But I would like to focus on 6 or 7 major points. One, decisive and informed leadership is critical to success in containing this pandemic. In countries where leadership have sort of wavered or did not have the commitment, or countries that were not very transparent about how data is generated, shared, and used, those countries did relatively worse than the countries where the leaders were decisive, took difficult decisions in spite of the unfavorable nature of the decision that you may have to take. Second, unfortunately, as I said before, we are not prepared for a pandemic or pandemic-like situation of the world. Health systems and services are skewed still towards hospitals and hospital-based attention and care, and not enough to public health and public health needs. The world is very good at responding to a pandemic or an outbreak, but we do not do or invest sufficient in preparedness. In one of the previous presentations, he talked a lot about the IHR. The IHR was an agreement that has been existing for decades, revised in 2005, which lays out what are the core capacities countries must have to be prepared for a pandemic or pandemic-like situation. But we have countries that don't, because countries are constrained by resources, countries are constrained by other emergencies and needs, and therefore, in terms of preparedness, we are still poor. And I am afraid that we will, if we do not take a drastic turn at this point of time, we will still remain unprepared for the next pandemic. The pandemic forced the acceleration of digital revolution, but most vulnerable are still left behind by the dividends of digital revolution. Today, we are able to have this session with more than 500 people attending this and sharing information, which I think we did not use, although the technology was there, which we didn't use 12 months ago. But today, now, it has become almost normal to have your meeting all on digital platform. Likewise, telemedicine, we have for decades, but we never really paid attention till now when we suddenly realized that this is so important. And of course, there are so many other innovations in digital health that are there and which we should take care of. Unfortunately, the poor are left out of this because in order to take advantage of digital health revolution, you need the equipment, whether it is a laptop, whether it is a tablet, or even a smartphone. And many poor people cannot afford that. Many poor people have no access to internet. So we have children that cannot go to school, but don't have access because they lack these. And therefore, we are missing a generation of children in their educational career. While we are seeing tremendous advances in this, we still have major gaps that the countries really need to look at. One of the other lessons is that countries always are by response sort of, my country first. But what the pandemic demonstrated is we are a globally connected village, if I may say so. And the whole logistics of the world is interconnected so that one part of a component of one item may be produced in several countries and then put together somewhere else and then managed from somewhere else. And this pandemic disrupted that totally. And we had a situation where essential equipment was available. In many situations, it was not available, but it was available. But we have no means of transporting them or shipping them to the countries that are needed. So the lesson is that the world is an interconnected world, and we cannot cut ourselves off from the rest of the world, or the rest of the world cannot suddenly say, we close all borders and therefore have no interaction with any other country to prevent the disease coming in. I think it doesn't work. And I think this is a very clear in this. The world is one of the most important lessons and where we need to strengthen is how we deal with information, particularly with the social media that we have today. At the click of a button, the information is worldwide, and therefore you have a host of peoples and groups that are out there trying to make mischief, spreading wrong information, spreading, rumors, causing all kinds of problems. And and we have to deal with that, and suddenly we find that we really don't have both the capacity as well as the thinking in order to deal with this sort of infodemic that seems to run ahead even of the pandemic itself. And finally, to say again that the pandemic, like many other diseases, affects the poor more, the poor and the disadvantaged more than the general population overall. So again, the pandemic, like many other diseases, again has this impact for the poor and the more disadvantaged. Next, please. I think that's my last slide. Yeah, so a brief word on going forward. Sort of, this is very sort of high up thinking on that. First thing is that we have to build on the strengths that we have. And in many of our countries in this region, and of course globally as well, we have very strong foundations of primary healthcare. And this has been amply demonstrated, the value of having a very strong public health, primary healthcare foundation in countries, whether the example of Thailand, and we're going to hear that later, examples from Sri Lanka and from my own country, Bhutan, where there is a strong infrastructure, network, and investment in primary healthcare facilities and infrastructure. I think the countries have been able to respond better. Emergency response must be whole of society and whole of government effort, and not that of health ministry. Health ministry cannot build the capacity to be able to meet such a pandemic and sustain when there is no pandemic, inter-pandemic period, let's say. Therefore, we have to build a system where health has the resilience and the ability to move the whole of society so that the whole of government and the whole of society can come together to do that. And we again saw examples of that where in countries where you have very large community volunteers, as in the case of Thailand. Likewise, in Bhutan, we have a group we call Desung, which are sort of volunteers that come out to support communities in any requirement, whether it is a local public gathering or a national emergency like that. So we have to build in such a way that while there is a core capacity, we have to build a system that can bring together the whole of society and the whole of government to deal with that. We will need to relook at our health workforce, how we train them, how we deploy them, and how we look at building different skills on this. And I think this, again, we continue to follow the old model of health workforce, whereas the need today, I think, has gone a totally change in terms of the need and the capacity and skills that health workers need. I already mentioned our digital health. Countries really now need to take advantage of the digital innovation and build on it. For example, many of the, let's say, visits can be curtailed by using telemedicine so that you would be quicker, more efficient, and less costly, and yet make the services available. We, I think, are already learning to do a lot of our meetings, cutting down costs on travel and things. And then fostering research and innovation as we go forward, because we have to find new ways to do things to deal whenever we have problem like this. And finally, I think Indonesia, I'm happy that has a School of Public Health within the universities. I think countries in our region have to invest really in public health. And really, we need to have world-class public health institutions and facilities where we can train our future public health experts of the region. Thank you.
Okay, thank you very much, Dr. Namgil. It's very informative presentations. I think without further ado, I invite the second speaker, Professor Yanto Chandra from the Hong Kong Polytechnic University. Professor Chandra, you have 15 minutes for your presentations. The floor is yours now.
Okay, thank you, Ibu Agustin. Hello, everybody. Good afternoon. It's very glad to be able to speak to all of you here. I'm from Indonesia, but I'm working in Hong Kong, and there are a lot of Indonesians here in Hong Kong. Hopefully, I'll have something interesting that I could share with you. I think the reason why I'm invited to speak today is to provide a comparative view about what's going on, what has happened with regards to the pandemic. As you all know that Hong Kong is one of the earliest places in the world to have all these pandemic. So we were there from the very beginning. You could see Hong Kong as a kind of of what would happen in many other territories and countries. So I would like to put it that way. And secondly, I will talk a little bit about some of our work that have been published in journals that looked at what happened in China. And I'm going to provide a little bit of viewpoints, mostly from a public policy perspective. So I'm going to talk more about policy measures, non-pharmaceutical interventions, NPIs, and things from more social sciences perspective, because much of what happens at the clinical, at the healthcare support has been discussed, and the vaccines have been discussed early on by the previous speakers. So that's where I'm going to start with. Can I see the slides? I can't see my slides. It's very small. Can someone turn it on so that I can see my slides? It's only a tiny square. I can't see my slides.
It's already enlarged.
Okay, in that case, I've been asking this to the team early on, whether I can see my slides. Let me turn on my own slides so I can see what I'm talking about. So it's very small. Okay, so yeah, so that's the first slide, just to show where we are in terms of the pandemic. As of yesterday, it was 69 something million. As of today, it's already over 71 million. Indonesia is ranked over 71 million. Indonesia is ranked, rank number 1 and 2 and 3 is United States, India, and Brazil. Indonesia is ranked 19, China 78, Singapore 86, South Korea 90, and Hong Kong is 132, and New Zealand is even doing better, 162. So it's kind of interesting to see what's going on. We had actually a dynamic timeline video that we could show by plotting the data, but I think that's it's going to be very difficult to show on the screen. So this is what we have. So what I would like to talk more about is the kind of anti-contagion policies that have been implemented worldwide. So there's been a study that was published in Nature, and the data that they used was up to April 2020, so that was many months ago. So they collected data of around 1,700 local, regional, and national non-pharmaceutical interventions in these sort of 6 countries. So 2 from East Asia, China, South Korea, 2 from Europe, Italy, and France, and 1 from Middle East, Iran, and 1 from North America, United States. You can see what happens with these the anti-contagion policies there on the right. So what you can see there on China, on the China side, the declaration of an emergency situation from week 1 to week 5 really have a very strong effect in reducing the daily growth rate of the pandemic. So you can see that is range from minus 15% to 20-something%. And also travel ban relatively worked well, home isolation worked well. But if you look at the patterns with other countries, there's some similarities and slightly some differences. If you look at South Korea, for example, when they have a close of religious activities and welfare activities and no public demonstration, you can see it has a very strong effect on the daily growth rate. It really reduces by like 20-something%. And if you look at Italy, work from home, no gathering, and some sort of other forms of social distancing, it really doesn't quite have a as effective as an effect compared to some of the other regions. In Iran, like travel ban, work from home did have an effect, right? So Iran, you can say Iran, South Korea, and China, in some way, have some similarity in terms of the effect of this social distancing in general terms. In France, there's a little bit of similarities but differences as well, like cancellation of events, gathering, and social distancing have a very large negative effect on the daily growth rate, right? Minus 20-something %. United States is another story. So you can see there some of the things that have been used are not really working well. So we can see, but there's some similarities that, you know, some things work, some things doesn't really work. And then from the same paper published by the same group of, where is the slides? This slide is not moving. Hello? Yes. Yeah, and then the third slides, yeah, sorry, the fourth slides, right? The fourth slides. If you look at the next one, can someone turn on to the next one? Let's run the next one.
Slide berikutnya.
The next one.
Slide berikutnya.
The next one. Yes, this one. So it's the same from the same paper. They look at the implementation of those policies and what would have happened with a pandemic without those anti-contagion policies, right, or non-pharmaceutical intervention policies. You can see the difference. So the actual is the blue lines that overlap with the black lines, and the predicted ones is the red line. You can see that from this graph, what happened to China and South Korea. Look at those on the right. There's a big gap between the red line and the blue line, right? You can see there's a big gap. That means that the anti-contagion policies implemented in these countries have been working really well, right? So if they hadn't really implemented this, things would go along the red lines. If you look at Italy, it's a relatively similar pattern with China and South Korea. If you look at Iran, it's looking even better. You know, it's a very large gap between the red and the blue lines. But what happened to the France and the United States is kind of a little bit different from these other regions. We still don't know why. And again, the data is only up to April. So you can see the gap between the red line and the blue line in France and in the United States is relatively smaller compared to those other countries. And we could speculate why. We don't know. But you can see that the policies that have been implemented in France and in the United States didn't really work well as expected. Let's go to the next slide. This is another paper published in Nature Human Behavior. Again, they look at non-pharmaceutical interventions by government or policy measures implemented by the governments. And they have a data of over 6,000 interventions in 79 territories. Again, the data was from March to April 2020. And then they classify them into smaller set of 46 NPIs, with at least 5 times happen. So these are the most important parts. And you can see there, so they have rank order this data according to how effective they are in reducing the RT. RT is the reproduction rate, right? How much this is reproducing. As mentioned earlier on by Dr. Iwan, we want R to be lower than 1, right? So it shows a decreasing trend if R is lower than 1. So you can see there, the ones that I've highlighted in pink color, like small gathering cancellation is working very effectively across the 79 territories. Closure of educational institutions work very well. Border restrictions, increase in availability of face masks or PPEs, and restricting individual movements. And in some places, there are national lockdown and mass gathering cancellations. So what we can see from this, of course, if we look down further, some are also very effective, some are not so effective. If you look at down there, one of the dots that I show there is environmental cleaning and disinfection. It actually has very close to 0 effect in reducing the R. And if you look at down there at the bottom, some of them are actually still quite positive. So surveillance and active case notification and measures in public transport, laboratory testing capacity doesn't really help in reducing the reproduction rate of the pandemic. But what we can see from the top ones, the ones that have been shown to work really well across the 79 territories, which is quite a lot. Very simple. It's all about social distancing. It's all about travel restrictions and getting people to wear face masks and PPE, etc., etc. So at least this is telling us something, and it's not so surprising to my own eyes. And this has been mentioned, but it's good to see this in a comparative sense. And it has been published in a top tier journal, and we can be sure that the findings are credible. So let me go through a little bit to the context of Hong Kong where we are now. If you remember, we had an experience of SARS in 2003. So can someone turn on the slides to the next slides? Yeah. So we had experience of SARS in 2003. So if you look at the graph there, up until around 3 months, that we see that the reproduction is going to a very huge decline in terms of the SARS virus. And what happened to Hong Kong at the time? Why did we have a really good handling of the SARS epidemic at the time? So we had a lot of prevention and control measures. We have a lot of public measures. We have a lot of public education to encourage people to take part, really. So this is partly the work of public communications in healthcare, and also tracing the source of infections. Some of these are related to certain public housing buildings, and a number of control measures like isolation, surveillance of people who had the virus, closing the schools and universities, exchange of epidemiological data between Hong Kong and China, because China was affected, not only Hong Kong and China, but also other countries in East Asia and Southeast Asia, like South Korea, Japan, Taiwan, and Singapore. And a lot of temperature checking, district-wide cleansing, and strengthening the collaboration and communications with, of course, China and WHO, and diagnostic tests. So these are kind of like, I could say, there's this memory about SARS in 2003, so that when the first case of COVID-19 happened in Hong Kong, people reacted very quickly. Can I go to the next slide, please? Yeah. So this is in a timeline of what happened in Hong Kong. So far in Hong Kong, we've been experiencing 4 waves. Of course, how we define waves is very particular to the Hong Kong standard, because the government here used a very stringent standard in terms of naming when we have a new wave, right? So in my understanding and looking at what happened with the public announcements about the wave, typically when you have double-digit figure of infection rate, that is already considered as a new wave. So if you have countries, in other countries that have a few thousand of infections, by Hong Kong standard, using Hong Kong standard, that they are already a few thousand waves already. So in Hong Kong, we are still considered 4th wave because, for example, the most recent one, we have 100 over cases in a particular day, that was classified as a 4th wave. So it really depends on how different territories or countries define what is called a wave. So early on, we have first, so the data that we plotted here came from the Center for Health Protection from the Hong Kong government. We plotted it up to the 8th of December. So what we can see here is the timeline of how the incidents happened. From the first positive case recorded, that is around the 3rd week of January. And if you remember, around the same time, by late January, Lancet, the editor of Lancet, had published 5 papers about COVID-19 and warning the public and telling how serious this is, how uncertain this is, and we could be facing a very serious situation with this virus. So let's put that for a moment on the side. And then the first wave in Hong Kong really started by family gatherings. So it's people who didn't know they had this, and the family gathering, and that really spread very quickly. And then we have the second wave. That's around March. Mid-March to late March. That is started by the bars. So a lot of bars, people go to bars. As you know, if people go to the bar, people drink, people don't wear masks, and when you speak or when you cough, even without coughing, just speaking, salivas in a very minuscule size could float around, and this is how it spread. So it's called the bar and the band clusters. And then we had the third wave. So we kind of like thought, well, things are kind of like under control for a little while, and restaurants were open, and people almost went back to natural activities, and weekends were crowded, crowded public places in the weekends. But suddenly around July, we had the third wave, and this was prompted by another wave, and this was prompted by a number of sources. Some of them related to the air crew and sea crew, who at the time sort of like some of the missing gaps that were not really, some have really looked at this as possible sources. So this is one of the sources, but also from again from restaurants, from elderly home center. So things are spreading around there. So the third wave was pretty serious. So you can see the blue lines, they were very high, right? And then after the third wave, we thought like things were pretty much under control and everyone almost relaxing again. So it's very frustrating, isn't it? So, and then we went to a very low rate of daily growth. You can see that, and suddenly we have the fourth wave. This is just happening around late November. And that was prompted by dance and singing groups. Again, when people are in the dancing floors, people don't wear masks, etc. So, and right now we are still we don't have the data there because this was plotted until 8th of December. But things are moving very rapidly. Can we go to the next slides, please? Yeah. So this is another way to show the plots. What we're interested in is the red line, which is showing the increase in the incremental increase of the infection, and the blue line is the people who recovered, and the death. Again, the death rate in Hong Kong is very low. Until today, we only have around 114 deaths, and overall we have 7,300 something total infection up to today. So I would say we are not doing too badly compared to other territories, but of course we could still improve the situations. Can we go to the next slides? So what happens next in Hong Kong can be explained in this slide. So this was published by the Center for Health Protection in April. This is what has been used by the Hong Kong government. We have a lot of transportation suspension, border control, work from home policy, compulsory quarantine, restaurant capacity restrictions. So right now, a table in a restaurant can be shared by 2 persons. So for some time we have like 4 or 6 or 8, and now we are back to 2. So one table can only be shared by 2 persons. I don't know how it's actually being implemented in other places, but this is how it works in Hong Kong. And also, restaurants can only have dine-in customers up to 6 p.m. So after 6 p.m., they are not allowed to have people going in and eat inside the restaurants. So you can have a takeaway, but you can't sit in. And also we also have a prohibition of gathering. So as I said, why we have a sort of relatively sort of smaller total number of infection is partly because people are really paying attention to what's going on. And again, SARS has played a very important role in sort of reminding people that things could go very wrong if people are not taking part. And this is another way. Can we go to the, sorry, can you go to the previous slides? Next. Next. Sorry. Okay. I think I didn't have the latest slides shown there. Okay, let's show the topic modeling results. The topic modeling results for Hong Kong. So this is one of the ongoing work that we are working on. We collected a huge number of news articles on a major news outlet in Hong Kong by focusing on the keyword COVID-19. And we use a computer science technique called topic modeling to probabilistically understand what topics appear every day across the January to 4th, so it's about 16 weeks data. What kind of topics emerge in the newspaper? As you can see, the newspaper is a reflection of what people are paying attention to, or what the country or territory is paying attention to, or what's going on in their own territory. So we can sort of see this from a government response, civil society response, and business response. So you can see from early on, look at the orange color with the numbers there. From the early on, we have a lot of reporting, reminding people about the mitigation, like social distancing, etc., containment, like quarantine, treatment, a lot of rumor dispelling, because I heard a little bit just now that there are questions about hoax. So we had a lot from the very beginning efforts to dispel rumor, whether this is conspiracy, whether this is this is real, is it really infectious, etc., etc. And of course, there are also a lot of civil society response in terms of how people are helping one another, donation, etc., and how the business are responding to this. Can I go to the next slides? The topic modeling in China. So the topic modeling for China. The previous slides.
Slide sebelumnya.
The previous slide, please. Yeah. So if you look at this one, we did the same method. We applied this to a major English newspaper from mainland China. The topic is quite diverse and quite mixed. But of course, it also tells us that there's a strong government response there, and particularly if you look at from the first week, public information campaign has been very strong. Containment strategies started from the very first week of January. Civil society response also happened, if you can see in the later weeks, but also a lot of business response. So I want to talk much to this. So in the interest of time, let me go to the next slides. So the next slide is this is what we published recently in a journal. We captured data from Weibo, the users of Weibo, which is the largest social media in China, about how the citizens are using their social media for what, and how is it really helping. What we learned from the China experience here is they use the social media as a coordinating tool, because when you have a disaster of such magnitude, of such scale, you will face a situation of a lot of information asymmetry. So people at the top don't know what's going on at the bottom and what happens on the streets. And people on the bottom cannot really voice their concerns, etc., to whoever who can help them. So what we can see that is Weibo have been working together with the government to provide a particular channel for citizens to ask for help. So this channel has, as we can see in these two plots, we can see that the number of people asking for help in Weibo has surged in that from early to mid-February, and it's sort of like going down. But you can also see how the request of help-seeking sort of request has been dealt with. A lot of people come to help them, so you can see how quickly everyone's help-seeking request has been dealt with by the public. So this is one of the first papers that reported about what happened in China. So you can see there's a strong collaboration between what the government is doing, because the government in China have a lot of layers in their public health ministries, from the central to the provincial to the very local and district. And apparently they work very well with the non-profit sector that are actually helping the citizens and citizens voicing their concerns on Weibo. And let's look at the next slides about what are the citizens are talking about in Weibo. Can we show the next slide? Yeah. So you can see from like very early January, people start talking about there's a new type of pneumonia. That's January 23, 24. And if you go to January 27, 28, people start talking about isolation and coronavirus. So there's a name already, right? And then when you go down to January 29 to 30, we start to see people talk about prevention, go out, wearing masks. So again, this is using topic modeling, in which we use a huge set of unstructured data from Weibo to plot this. And these are probabilistically the most important words that appear across those dates. And we read them from the left to the right. So the most important appear on the left, and the lesser important are on the right. But these 5 or 6 keywords are definitely the most important keywords that appear in the newspaper. And if you go down further, you can start to see more and more interesting happenings with the medical teams, with a lot of volunteers taking place, helping, etc., etc.
Professor Chandra, can
yes,
you make
I'll go very quickly. So the next part is volunteers and business collaboration. So this is just to quickly highlight that there's a lot of frontline medical workers who are women, and they need women's products, panties, etc. So there's a lot of work has been going on in order to sort of work together to bring efficient relief response to their needs. So they have Pampers, etc. So it's a collaboration of multiple parties. And this is, you can have a look at that later, the topics that we come up with. But of course, not only those, we also see a lot of citizens are playing part. We have seen community fridge. People are donating foods, put them on the street, and allowing people who need. So actually, this is the economic part that needs to be done. And also apps to track where the masks are available. We also have Project Ultraviolet, where people are providing UV light disinfection systems. And a lot of Hong Kong people were taking part in making a reusable mask. And even we suddenly saw the rise of 200 mask factories in Hong Kong. And a mixture of for-profit, for non-profit, and a social enterprise model. So just a quick reflections of what we have learned so far from understanding the regions that are more or less successful in handling the COVID-19 versus those that are not so successful. We have learned that those that are most successful have prior experience with dealing with the epidemic. They knew how to respond. People quickly responded by wearing masks. The government acted decisively at the start of the pandemic. The third one is the multi-pronged policy measures. Of course, a mix of these things that I mentioned early on: border control, social distancing. Some have lockdown, some don't. Contact tracing, etc. Wearing masks and personal hygiene are very important. There are many types of personal hygiene, not just washing hands, including putting like wet cloth that have been soaked with bleach before you enter the house and you need to clean your food. So there's a lot of techniques there. Face mask availability, mass production, and a lot of mutual aid. And this is not so much talked about. People are sharing food with the needy groups. People are sharing masks and sharing hand sanitizers, because we had experienced this at a time when there were no masks in the market in Hong Kong. And of course, some people talk about collectivism or individualism. So it appears so far that the territories that has a collectivist culture in which people wear masks, for example, wash hands, for the sake of not just for themselves, for those around them, have been more or less successful. I'm not saying those that are embracing individualist cultures are not very successful, but we have seen more successful cases from those that are embracing the collectivist culture. Of course, there's a trade-off between economic and health, but like what we experience, do we prioritize economy or health? In Hong Kong, we have gone through the fourth wave because we have been up and down in implementing different policies, and we are not like providing a shock therapy to end this for once and for all. And of course, trust for scientists and experts are very important. And we have seen those regions and territories that are successful have trusted their scientists and experts. And lastly, the politicians' attitude towards the pandemic. I think the slides shown there are not following my presentations. I'm already the second last slides.
Dua dari terakhir, slide yang kedua dari terakhir.
Yeah, and I'm going to the last slides now. So in terms of the summary, I was posing an interesting question at the beginning, which I didn't ask, because medical workers have been hailed as the heroes in this COVID-19 pandemic. What's the role for other fields or other practitioners, right? And I was posing the questions whether social sciences can save the world. But what I'm trying to say here, a lot of the things that you heard today are the work of social scientists, and they're using big data. They're using computational social sciences to crack those big data to understand what we can learn about what works and what doesn't and why. So I would say that we need social scientists. We need social sciences more than ever in dealing with this pandemic. And of course, if we use the computational social sciences technique, we can learn and capture data at the granular level and understanding it at a macro level to give advice to policymakers. So we have seen actually the second rise of interest in computational social sciences. We also talk about global experience versus local experience. We have a lot to learn from Hong Kong, and I think other countries have a lot to learn from Hong Kong's experience in how we handle this. We have not been the most successful. I think we have been quite successful in handling the pandemic. Of course, the question is to what extent the experience from Hong Kong is applicable to other countries. So this is a question about a contingent or universal. I do embrace a contingent policy perspective, which means that we need to take certain parts from other countries that fits in well with a particular other countries. So there may not be a universal policy. And the other question is whether you want to do a shock therapy or you want to do a half measure. Half measure is you do a slight social distancing and you pull it back. You implement social distancing and pull it back on and off, on and off. Or you do a shock therapy and get people to stay at home for 2 months. What will happen? So these are still the questions for future research. But what we have seen, have been working so far, is social distancing, travel restrictions in all kinds of forms, and the use of face masks and other PPE are very effective. And we also seen that cross-sector collaboration between the government, society, and business are very important. Mutual aid are very important among people. And there's a lot of interest from the previous talks and from the audience about vaccines. Now, I don't know about what happens in other countries, but in Hong Kong alone, we have seen this virus keep on mutating. The question is, once we have these vaccines, can these vaccines catch up? Can it handle the new variants of COVID-19? I don't know. So this is a question to ponder. And lastly, we need more global collaboration, definitely. It's not the time to argue against each other. It's the time to work together to end this. That's all. Thank you.
Thank you so much, Dr. Chandra. A very interesting presentation and very inspirative, because you told us the Hong Kong experience in this case. And it's very, very inspirative that social science play a very important role in facing this pandemic. And then Indonesia also have the same situation, that we have problem in changing the work. What the behavior of the population. Okay, dear participants, so let's proceed to the next speaker. We will have Dr. Pramon Viwatanakulvanit from the College of Public Health Sciences, Chulalongkorn University. Dr. Pramon, you have 15 minutes for your presentation, please.
Can you hear me? Can you hear my voice?
Yeah, we can hear you.
Okay. Thank you, Dr. Augustine. So I'm waiting for my slide from UIT. So first of all, I would like to thank you to School of Public Health, University of Indonesia, for the wonderful meeting today. So in my presentation, see my slideshow up already. So what I'm trying to talk today is I will separate into three parts. The first part is about the overall of the Thailand situation, about the COVID-19. Okay? And the second part, I will talk about how the academic institution handles the COVID-19 situation. I will give you the example of my school as well. And also the last part, I will talk about the national level, how Thailand handle the situation of the COVID-19. Okay, next slide, please. So this is what I told you already. I separated into three parts. And the sorry. Next slide, please. Next slide, please.
Ya, slide berikutnya.
Yes. No. The previous slide.
Slide sebelumnya, sebelum yang tadi. Nah ya, ini sebelumnya.
So this is the situation up to date right now about the COVID-19 cases in Thailand. Right now we have about 4,100 and also 3,800 recovered from the COVID-19, and you have the 200 still in the hospital and 60 people died of the COVID-19. This is the information that update on the December 10th. Next slide, please. Now, this is a graph for the new cases of the COVID-19. Actually, we got the situation in last March and last April because we have like a super spread of the COVID-19 in the boxing arena. But later on, we handled all the situation and tried to maintain and keep the new cases low. And also, up until this point, we still have the challenge right now. And then we go into the details later on. Next slide, please.
Slide berikutnya.
Anyway, but for the university level, the way that we handle the COVID-19 situation actually is began by the beginning of this year. The management team and the president of the, my university, they started to communicate and give the guideline and preparation for all the staff, all the students as well. So you, at that time, I remember that we got to switch from the regular class into the online class. And also at the same time, we need to follow kind of the COVID-19 prevention guidelines from the university. And you can see from the picture that I put, so you can see on the right-hand side, the university also supply the kits, like the guideline, the mask, alcohol gel for us for the COVID-19 prevention, and also the policy that we check for the temperature when you go into the university. Everyone needs to be checked out for this. Next slide, please. At the same time, as you know, that COVID-19 situation also impact on the economy. So some of the parents, they got laid off and also out of the job with no money to support their children. So the university tried to support them with the scholarship or also the financial aid as well. you can see in my slide. And also that's when we switch from the regular classroom into the online classroom, we also know that some students have financial difficulties. So we lend the notebook to them and also give out some of the SIM cards for them to access to the internet. So this is the way we help the students. So next slide, please. Along with this study as an academic institution, we also transform the this study into the real practice with many kinds of innovation to support the community and also the medical professional. And I also put telemedicine as well. This is quite a famous one that we created for the robotics to help the medical professionals to communicate with the patient without the direct contact. Next slide, please. Also, right now, we still under the development of a vaccine as well by the university, and it's still going on in the process. Next slide, please. Next slide, please. Next slide, please. Well, can you change to type of the PowerPoint that I sent to you? Share my on screen. Would that be okay? We can go on.
Yeah.
Can I share my own screen?
Okay. Dr. Pramon, it seems that there is some problems in the committee about your slide. Can you please share your screen by yourself, please?
Sure.
So we will end the share screen from the committee, yeah, and then use your screen share screen.
Can you see my screen now?
Okay.
Okay.
Yeah.
Let's
Yes.
jump. Okay.
Yeah,
Thank
that's
you so
good.
much. So let's jump to the nation level about Thailand, how the nation handled the COVID-19 situation. It began by the beginning of this year as well, that we launched the unit called Emergency Operations Center. But the problem is about the coordination. So that's why we need to launch the new unit that we call the Center for COVID-19 Situation Administration to centralize everything. And the leader will be the Prime Minister. And this is the case that I showed you already about the graph of the new cases. And right now we are also in a situation to manage, not to allow the wave to happen. Let's talk about the key factors or the key success factors on the COVID-19 management in Thailand. In this sharing experiences, I would like to say that maybe you need to apply to fit your individual country as well. But this one is like sharing the knowledge. So I will talk about what the World Health Organization perception about how Thailand managed the COVID-19 situation. The WHO pointed out two things. The first thing is about the investment in the healthcare infrastructure in Thailand, and also the collaboration among many sectors. So that's why Thailand can maintain and control the COVID-19 situation. So the first key success factor is linked to the WHO. about the village health volunteers and the strong medical team. And as you see from the picture that put on this slide, you can see that we got a long history about the healthcare infrastructure development. You can see that the project of the village health volunteers we launched long time ago, almost 4 decades already. And the roles of the village health volunteers, they have a strong relationship and also have the bond with the healthcare workers and also with the community leaders. So that's why this is the reason why they work effectively and also efficiently. And right now we have the village health volunteer all across the country, about 1.4 million public village health volunteers. And also with the support for the Ministry of Public Health to provide the guidelines for the village health volunteers along with the supplies for their COVID-19 prevention. So this village health volunteer depends on the knowledge and also implement kind of the strategy about door-to-door strategy to follow up the district group and also pass on the knowledge to the community. This is a picture of the village health volunteers. And the second key factor is about the law and regulation. We cannot deny that we cannot avoid implementing the law and regulation. At the beginning of this year, also Thailand also locked down as well. But the way that we locked down, later on, we did it step by step. I think this one is very important with the clear communication to the public, the way we lock down. At the same time, when the situation getting better, we try to relax the situation and implement the step by step, phase 2, phase 3, phase 4, because we also concerned about the way of the people living as well, especially for the economic impact during the COVID-19 situation. And the third key factor is about combination with the technology. Village health volunteer, they also have the application called Osmo Online that help them to update the situation, record the data, the knowledge to educate the community, and the way to follow up the quarantine. This is application help them a lot. Along with the national application that we call Thailand application, this one help to track down the cases of the COVID-19. Because right now, the way of the Thai people go outside, let's say like a go shopping mall, go to the kind of the area that need to get together a lot, we need to scan with the QR code for check-in and check-out. And this information is sent to the government. This helps a lot to track down the COVID-19 cases. And also the fourth key factor, the screening and expenditures. Thailand, we have the 3 health schemes, okay? But what are we talk maybe in the social security scheme and universal coverage scheme? These 2 health schemes cover most of the Thai population. So the government try to communicate about the way that if you want to get the COVID-19 test and also covered by the health insurance scheme, you need to pass the 2 criteria. Because you have like a fever along with some of the respiratory symptoms, and also the second criteria about the history of the exposure risk, for the COVID-19. this one really important. Not everyone just go to the hospital because it's gonna be burden to the healthcare teams and also risky for them to get infected for the COVID-19 as well. So this one also important. And if you have these two criteria and you can go to the hospital and the healthcare scheme will cover all the expenses. And then the fifth key factor is about fact-based communication and centralized structure. The centralized structure, I already told you that we launched the new unit to solve the problems of the coordination because the leader will be the Prime Minister of Thailand. And also the fact-based communication, what that is mean by the fact-based communication, because the government set kind of a spokesperson who have the medical background to communicate about the COVID-19 situation, to update the situation to the public. And some other speakers also mentioned about the fake news, rumor about the COVID-19, a lot of fake news. So this one also solve the problems about the fake news as well, because the way that government try to communicate, they broadcast the COVID-19 situation every single day on the television. So all the Thai people can update the situation of the COVID-19 problem. Also, the sixth key factor is about economic boost by the government. The government provided 3 options for you. You must select 1 out of 3 to help maybe for the financial difficulties. For example, the first one that I also use as well. The government mentioned that if you use the buy something during this time, and you can use the bill for the tax deduction as well, and this can deduct up until the 30,000 baht, and that is quite a lot. And also have some many projects to help the economy. If you go to the restaurant, you load the application for the government, and maybe you don't need to pay the full price of the food. You just pay half, and half of them the government will pay for you.
Dr. Praman, can you please make your presentation faster, please?
Sure. And also, this is the key challenge for the COVID-19 in Thailand. I think the first one is the illegal returning to Thailand, that we got the issue of the some Thai people sneak into the Thailand, and also they also brought the COVID-19 into the country as well. So we got to stick to the law to solve this problem and enforce the law. And I think it's linked to the awareness and social responsibility that the government needs to make a campaign again and again about this. Also, the economic impact is another challenge that Thailand is facing right now. This is the situation that analyzed by the World Bank Group. And this is the project, I think, created by some Thai people. They call it the roadside community pantries. You can see from the picture that people who can survive and afford kind of the COVID-19 situation, they put the food, free water, and a lot of items into the cabinet and give out the food and water for free for the people who have financial difficulties. And also, the next challenge is the misperception and human behaviors. Because right now, I know that in my country, some of the people also ignore some not wear the mask properly or didn't wear the mask. So I think it's maybe because of the situation that Thailand seems to be handle the COVID-19 situation very well. So that's why some people only ignore about this. So I think this one also linked to the human nature. So the way to solve this problem, I think about the policy campaign and educate them to understand more about the situation, not to ignore about the COVID-19 prevention practice. So this is almost my last slide. The key message that I want to point out. I think the strength of the Thailand that can handle the COVID-19 situation is about strong healthcare infrastructure and also the village health volunteers that they work really hard into the community and for the screening COVID-19 as well. And also the collaboration among many sectors along with the public education and social support. Also important for the regulation and implementation. And right now we face the challenge about illegal travel to Thailand, economic impact, and the risk perception. So I think this kind of the situation, like some professors say that we cannot work alone. We need to work together because it's a global issue. So I think it's time that the people need to realize that the situation needs the collaboration together. Thank you so much.
Thank you, Dr. Pramon. Very interesting presentation. We have learned how Thailand deal with COVID-19 pandemic. Ladies and gentlemen, so we come to the last but not least, of course, resource person, my dear colleague from Taipei Medical University. I invite Professor Betty Yawenchu to deliver your presentation.
Thank you.
You're
Thank you,
welcome.
Agustin.
Yeah.
Nice to see you all. Okay, so good afternoon. I'm Betty, and it's a great honor to be invited to talk about the management of pandemic control in Taiwan. I would like to start with the first photo. Can I have my presentation slides?
Yeah.
Thank you. Yeah, it says 0. Okay, outside the Grand Hotel. And we were celebrating the very first day of zero confirmed case after almost 3 months of struggling. And it's taken on the April 14th, which means we made it together and we will work it together. Okay, this is me. I'm the Global Health Director at Taipei Medical University. And my another hat is the Regional Director of Asia Pacific Academic Consortium for Public Health. You can find me. We also have an official Facebook. Next, please. All right, so everybody saw these slides maybe many times already. I just want to say that the death number now is still rolling and more than 1.5 million so far. Next, please. How about Taiwan? We have 700 something cases so far and only 7 deaths. No locally acquired cases since April and no death cases since May 11th. Next, please. So we are very fortunate. We have 2 numbers which are worth number 1 from the bottom. Okay, the first is the confirmed deaths per million people. And the second number is the economic decline rate. Next, please. Yes, okay. So here's the 6 factors I would like to share with you. We learn from the SARS experience and we stay high alert and do timely response. And also conduct risk communication and information transparency. Also, we do proper resource allocation and try to use high tech to do transmission prevention. And also all the Taiwan citizens, they have very good etiquette. Next, please. So, yes, thank you. So SARS experience is a very bad experience, but a very good lesson to Taiwan. Okay, so we have 346 infected, 70 deaths back in 17 years ago. And about 100 cases are health workers, including 11 deaths. It's a very sad lesson. And a series of nosocomial infections were mainly found in big hospitals, which means our border control was not functioning well. And it caused And it cost $820 million economic loss. Back then, we don't have cross-agency integration mechanism in the government, and we were excluded from WHO, lack of international support, and the sudden hospital lockdown caused a huge panic among health personnel and the citizens. Next, please. Okay, this is a photo taken in 2003. The health personnel were so panicked by the sudden lockdown, and they crying out from the window saying that, oh, please do better isolation and quarantine. We don't want to wait and die here because you lock us with unhealthy people and a lot of SARS cases. So we learn from these and do a lot of changes. Next, please. Since then, we have a series of regulatory review and organizational adjustments. We amended Communicable Disease Control Act at least twice, and then established the National Health Command Center. And we learned that from US CDC and Department of Health of the American. And then this time we can establish the COVID-19 Central Epidemic Command Center in a very short amount of time. Next, please. So this is the structure of our National Health Command Center, which is a cross-agency integration system with 3 sections: the logistics and the operation and the intelligence. It was composed by a group of high-ranking officers from more than 10 different ministries. Okay, so something very special is about the intelligence section, which is led by the advisory group. Okay, next, please. All right, so this command center is led by a team of experts, and all the important decisions are made based on the disease prevention expertise. So they will continuously adjust case definitions and the criteria for case reporting, revises clinical and medical treatment recommendations. Next, please. All right, as they are well-trained MD or epidemiologists or with public health majors. Okay, for example, our former Vice President, Chen Jianren, the current Vice President of Taiwan, Lai Ching-te, and also the former Vice Premier, Dr. Chen Qimai. So I want to emphasize one point here is that public health education really matters. So Augustine, we are doing a very good job now. Okay, next, please. This is the photo that Premier Su Zhenchang visited the command center a lot and say all the encouragement word. Okay, next, please. And also our President Tsai Ing-wen visited the command center many times and give full support to the whole team. Next, please. So recently, she was elected as one of the 100 most influential people in the world by Time magazine. If I may quote, they said, it's hard to find a world leader who's had a better 2020 than President Tsai Ing-wen. She won re-election in January and oversaw one of the world's best response to the pandemic and health and economic recovery. And when especially compared with these two gentlemen, Trump was diagnosed with COVID-19 once, and Johnson in the UK was diagnosed with COVID-19 twice. I think our president is very healthy and strong. Next, please. All right, so it started from the New Year Eve, the last day of 2019. Our Taiwan CDC noticed information from social media indicated that there are at least seven atypical pneumonia cases reported in Wuhan, China. So Taiwan CDC immediately called the press conference, notified WHO, and started on board quarantine of passengers on direct flights from Wuhan. Next, please. So this is the notice we got. We are very lucky that we can read Chinese characters. Okay, it says emergency notification was issued by the Wuhan Health Committee, and saying that there are some atypical pneumonia cases. Next, please. So we started to ban the entry of Chinese nationals from Hubei since January, and then ban all the Chinese nationals, including Hong Kong and Macau, on February. Kept monitoring international situation and adjusting travel notices. All the travelers from outside, they are mandatory to do self-management or home quarantine for 14 days. Next, please. And we started strict border control since March. We banned all the foreign nationals, including the travelers from transiting through Taiwan. Next, please. So even all the Taiwanese people, they took the charter flight and come home at our Taoyuan airport. They have to wear the PPE all the way, okay, before they get on the plane and until they landed. So this is the photo show that personnel at the port carry out disinfection of all the passengers' luggage. Next, please. And we sent quarantine personnel to board the sea cruise to carry out quarantine work and the physical examination to guard every point of entry. Next, please. And our Taiwanese people are very alert. They learn from SARS very well, so they start wearing masks, line up to buy masks in front of a pharmacy. That's a photo earlier on February and March. Okay, I call it personal border control. Okay, so we do a risk communication. The command center hosts daily press conference since January, and enhance the capacity of official line and Facebook to make sure every people can get the correct information from the government, and also enhance the capacity of the consultation and the reporting hotline to make sure that we communicate very well, and all the promotional materials and videos in six different languages for different groups of people, such as migrant workers and foreigners in Taiwan, are all in hand. We want to make sure leave no one behind. Next, please. Okay. This is just to show you our promotional material in Indonesian. Okay, this is the for the second wave precaution, just started from this month. Okay, we call it for winter COVID-19 prevention program, and we tell people have to wear masks in 8 types of public venues to prevent community infection. Next, please. And also border quarantine. We require all the passengers or travelers have to give us the COVID-19 RT-PCR test results certificate issued within 3 days before they can enter Taiwan. Next, please. Also, the government enhanced case reporting and the screening with incentives. Next, please. This is a photo of our command center press conference. Okay, next, please. And everybody know him. He's the commander and also the Minister of Health, Dr. Chen Shizhong, also TMU graduate. Next, please. Okay, and we use information technology very well. For example, we link the National Health Insurance Database with the National Immigration agency database to make sure the frontline healthcare workers are immediately aware of suspected infections based on the travel history and the symptoms, and link with the platform and the cloud system to follow up the notice. Next, please. And do proper resource allocation is also very important. Okay. We allow citizens to bring their national health insurance IC card to purchase face masks. Okay. And they can see the location and the stock of the masks from the government open data platform. As of May 24th, more than 20 million people have purchased masks in the system. Next, please. And also, we make sure that the equipments were distributed very well to the local governments to protect the prevention personnel in healthcare institutions, and also government coordinated and match producers to make sure enough supplies is made. For example, the thermometers, alcohols, and isolated gowns, etc., etc. Next, please. And we use digital fencing tracking system to monitor the home isolation or quarantine people. We monitor their electromagnetic signals from the mobile phone. So if the mobile phone signal is not normal, the warning will be sent to the people, to the health agency and the police. And if the signal kept abnormal, the penalty can be up to $35,000 US. Okay, next, please. And we would like to give the credits to the Taiwan citizen. Okay, they all have very good etiquette. Now everybody understands the importance of personal hygiene, including wearing masks, washing hands, keep social distancing, and cooperate with the government policy, and adopt the new lifestyle and the new normal. Next, please. Okay, this is the photo to show that people take public transportation and they wear masks in line with the policies. Next, please. When they go to the concert, to the temple, to church, whenever there's a mass gathering, people wearing masks all the time. Okay. So the next step is we have to prepare for the future, and Taiwan is trying to prevent the second wave. Okay, so medical technology is important at this stage. So government invests more on the R&D of rapid test kits and related pharmaceutical products. And we have at least 3 companies which are producing vaccine. And also Taiwan government joined COVAX and also try to procure from the international pharmaceutical company for effective and good vaccines. And of course, we invest in public health more. The very first Public Health Specialists Act just passed this May. And I have to emphasize that Taiwan is willing to share and cooperate with regional and global health partners. Next, please. And here is what I suggested. Okay, we can play a big role together. For example, education, research and evidence. We can raise awareness and engage more policymakers and students, also provide innovative ideas. And last but not the least, just like the other speakers emphasized, we have to have better international and global cooperation. Next, please. Once again, thank you for your invitation, and it's good to see Agustin and all of you here. I have visited Indonesia more than 5 times. I would love to visit this beautiful land again whenever I can get the effective vaccine. So let me say, let the collaboration continue. Terima kasih. Thank you.
Okay, thank you so much, Betty. I understand you have a very tight schedule, and since we have a very behind schedule of this webinar, so I can understand if you should leave this webinar before we have the discussion sessions. So thank you so much for attending and joining this seminar. And I hope your information and presentation will really inspire all of our students, the participants of this seminar. Thank you, Betty.
Thank you. Bye-bye.
Bye-bye.
Sorry for my absence.
Yeah, thank you. Okay, ladies and gentlemen, so we already heard all of the resource persons for these second sessions. So I think we do not have so much time, but I have some burning questions that I want to raise, and then maybe our resource person can respond to this question. I just read the question. This is a question from Made Natasha Restu Devi Prativi from Universitas Indonesia. Seeing the success of other developing countries such as Thailand and Vietnam regarding the implementation of strengthening the public healthcare system in its primary healthcare facility, I am interested to know more about what has been launched by the WHO regarding procedures or guidelines on optimal public health services for a country. If the procedure exists, then what can Dr. Pam recommend us, the Indonesian, to further strengthen our public health service system amidst the views of the Indonesian people who still more to know and hear to the doctors than to the public health workers? Thank you. So this is question to Dr. Namgil from the WHO Southeast Asia Regional Office. Maybe Dr. Namgil, you can respond to this question, please.
Right. Thank you, Madam Moderator, and thank you for the question. You know, the principles and the framework for primary health care was enunciated at the Alma Ata meeting as early as 1978. And although we have sort of developed that further to call it primary health care in the 21st century, most recent meeting in Almaty again, where, 40 years after the Almaty primary PHC meeting, there was a revisit, and a statement was issued on that. And basically, the statement emphasizes the validity or the relevance of principles of primary healthcare as outlined as early as the first primary healthcare declaration, which was 1978. So I don't think there is any need for new frameworks as such, but in order to help countries move further, in the most recently concluded resumed session of World Health Assembly, the Assembly again adopted a framework for helping countries strengthen primary health care. So the basic framework, the guidelines and the principles that drive or that should drive primary health care already exist. I think at the country level, what we need to do for each of the countries is to revisit the principles and the current systems and see whether they are relevant or not and whether they need to change. For example, long before Indonesia went into this significant decentralized system, you actually had a very good network of primary healthcare centers, if I'm not mistaken, called the Puskesmas. And after the decentralization, while it still continued, my sense is that to some extent, the way it was managed, the way it functioned or thing did not quite reach the level that it used to be in the earlier times when it was a vibrant public health, primary healthcare network at the community level. And I think each country will need to relook what they have and see what they need to change in order to rebuild that network again at the community and at the primary level. So I would think that we have the knowledge, we have the experience, and we have the experiences from countries that we can always build on. And I personally think that there is no need to have new guidelines or framework to strengthen primary health care. Thank you. I hope that clarifies the point.
Yeah. I think what we need is the political commitment, and then a strong commitment from the government and all the governments, the local governments, and also Ministry of Health up to down to the local government, how we can strengthen the public health systems in our country.
Right.
Second burning questions. This is from Dr. Akso from the Faculty of Public Health Universitas Indonesia. Interesting, and I know that Vietnam successfully contained the virus in the early beginning with strict lockdown and movement restrictions. But how Bhutan and Sri Lanka have done differently from Indonesia? Also, with the uncontrolled local transmission happening, how do you make the projections for vaccine effectivity in Indonesia? Thank you. Again, this is a question for Dr. Pam.
Yeah, okay. Thank you. I think this question has multiple elements in that. So first, let me go touch on Vietnam. I think Vietnam is one of the success stories in terms of response to the COVID. And of course, recently there has been a little bit setback, but right from the beginning, I think Vietnam has been consistent and very successful in doing that, simply because they ensured the basic steps that are required to control the passage of the virus was taken by ensuring the manning of all ports of entries, checking, testing, and screening passing people. And at the same time, Vietnam shares a long border with China, and therefore Vietnam really focused on looking at the borders to make sure that there is no slippage of cases, and they focused on that. Now, coming back to Sri Lanka and Bhutan, again, both these countries really focused on the entry points. Of course, for Bhutan, we have a very long border with India, and we have a limited number of international entries through air only. We have only one airport. So from that point of view, that was relatively easy. But our long border is a major problem. And what we have is this very large group of volunteers. We call them as desungs. They are volunteers who are actually manning the border between the various towns along the border to make sure that there is no movement of people across without proper screening. And therefore, the government has been very strict. And surprisingly for Bhutan, there is no community transmission. They have about close to 500 cases, not a single death yet, and they have very strict criteria for people coming in, 21 days quarantine. So the tough measure, the whole sector approach, or the whole of government approach has been what I think contributed to their success. Now, Sri Lanka, as I said, has got a very good health systems infrastructure in place from the primary all the way to the tertiary level. And because it's an island country, therefore, the focus was on ports of entry, whether it is by sea or by air. And that is how they did. As soon as there was a case identified, test, trace, treat was very aggressive, isolated very quickly so that there was no long established community transmission. In fact, there has not been any significant community transmission in Sri Lanka, and they have put all efforts to ensure to do that. Now, the third component of that question was how do Indonesia or the situation of Indonesia relate to that? I think Indonesia has tried a slightly different approach, in my understanding. Indonesia did not go into any of these major lockdown aspects of that. So the focus has really been trying to identify cases early, trying to screen as many as you can, and then manage the cases as they came. So to some extent, I would say that the basic approach is there. That may not necessarily have the kind of suppression and rapid control that you would expect, but in the long run, I suppose they do. Now, there was the issue of vaccine efficacy. Now, vaccine efficacy and vaccine effectiveness are a little bit slightly different. Efficacy is when you see how effective this is in a controlled trial setting, usually in a randomized way. where you hear these days, for example, Pfizer vaccine talking 95% efficacious thing. But when it is rolled out in general population, its effectiveness is determined by many factors. First of all, the coverage itself. Second, first of all, I would say the vaccine efficacy itself. Secondly, the coverage, and then third, in terms of the coverage is affected by people's acceptability, the ability of the system to deliver to all the people that you need, and given the COVID vaccine is projected to be required for almost everybody, it is going to be a major logistic challenge for most countries, even if we have a vaccine that requires storage from 4 to 8 degrees centigrade, which is standard for all routine vaccine. But for Pfizer vaccine, for example, you require -80, -70. And most of our countries, and I don't think Indonesia is an exception, most of our countries in this region, that kind of ultra cold chain right now doesn't exist. And therefore, one, to get the vaccine early enough, two, to have the logistics and the capacity to massively roll that out, and third, the people's acceptability is all going to be key to whether vaccination will be a success or not. Thank you.
Okay, thank you, Dr. Namgyal. I think one last question. Two participants raised this question. One participant asking to Professor Chandra, Nina Ventiana from the Faculty of Public Health Universitas Indonesia, asking about your recommendation for a volunteer model in handling COVID-19 pandemic. While another participants also asking similar topics to, let me see, yeah, similar topics to Dr. Pramon, Dr. Yusuf from Puskesmas Karangpucung 2 Cilacap. How is the description about the village level volunteers in supporting quick response action in handling COVID-19? I think this is a very technical question because he is from the Puskesmas, the very grassroots level health facility. So I invite both Dr. Pramon and Dr. Chandra to respond to these questions.
I thought the first question, the first question was for me.
Yes,
and
yes.
It's about the volunteer model. I think
Yes, yeah.
there's a lot of interesting things going on with the volunteer model. I've shared in my presentations about the volunteer model in China, in which they use the social media to organize an activities, to bring people together, to do whatever they can do in whatever they can do, so they can organize themselves to deliver any kind of help to those people who need the help, whether it's food, whether it's medical supplies, etc., etc. And but what I wanted to say here is that it's good to do this in accordance to the local culture. So that's why I said I prefer a kind of a contingent policy approach, in which we try to do things in a way that is acceptable in that local communities. I just received a WhatsApp message just after I talk, and someone mentioned about what happened in Bali. In Bali right now, if people want to have some relatively large gatherings, they rely on the pecalang. Pecalang are those local sort of community leaders or sort of security heads who are well respected by the local communities. And the pecalang will come and organize and ensure that people are safe, etc., etc. So I think these are also a form of volunteer model. And I think Indonesia is very unique on its own. So maybe a lot of practices from other countries may or may not apply to the Indonesian context. So I think we should go back and ask, what do we have in Indonesia? Even Indonesia is so large, and what is in a specific town or specific province or specific city? What is the nature of the things that work here? For example, is it like the pecalang in Bali, or is it local religious leaders? Is it a local, I don't know. So there should be some sort of role models in the community who can help mobilize people for a better compliance, and also to mobilize resources, so that resources, for example, Some people wanted to donate something. They have a lot of masks, but they're not able to find where I should give this mask to. So this mask can be better utilized for the people who really need them and they don't have the money to buy them. So if there is an effort at the grassroots level to do this in accordance to what is acceptable and what is working well in that particular town or city or province, let's do that. I think that's going to work really well. So that's some of the sort of comments that I have. I know the time is running out, so let's pass on to the other speaker.
Okay.
For the
Okay, thank you, Professor Chandra. Yes, I agree with you. The local wisdom, we have to look for our local wisdom and then maximize, strengthen our local wisdom to face the pandemic. So I come to Dr. Pramon. Will you please explain a little bit detail about the village volunteers, please?
Yeah, in Thailand, village volunteers quite a long time ago as well. And I think the key important is we recruited the village volunteers from the community. So you can see that they speak the same language. Languages, the way that they talk together. And when we kind of implement the guideline or the policy to the village volunteer, because village volunteer they have like working with the primary health care. So when they got all the messages, they can go into the community leaders and also go into the family members and talk and communicate the knowledge, the way to prevent the COVID-19. So this is why I think the village health volunteers work efficiently and effectively for this kind of the COVID-19 situation. And also the support from the government as well. Like I said in the presentation about the supply, the mass and everything, so they can pass on all of this to the community.
Okay, thank you. Ladies and gentlemen, distinguished participants of this webinar, I think I have to end these sessions, although we are still very burning with many questions, and then I know at the question and answer chat, there are still so many questions also from the chat, question and answer chat room from the YouTube. Maybe I hope there will be another opportunity that we can meet again and then discuss more detail about many issues. I would like to thank to all the resource persons, to Dr. Pem Namgil, to Professor Yanto Chandra, Dr. Pramon Viwatanakul Vanit, and Professor Betty Chiu for accepting our request to be the resource person of the webinar. Your presence really enriched this webinar and really this discussion give so many insights, so many inspirations, and thank you so much for your participations. I think I will return back the floor to the Master of Ceremony. Again, thank you so much for your attention, for your kind, and may you all always in good health under the protection of our God Almighty. Thank you so much.
Thank you. It was my pleasure to be part of this.
Thank you so much.
Thank you very much, Dr. Agustin, Dr. Pem Namgil, Professor Yanto Chandra, Mr. Pramon, and Professor Betty for providing us with such valuable information that hopefully we can use it for a better pandemic management to overcome this situation. Thank you again. We highly appreciate all of your sharing. Ladies and gentlemen, as we almost come to the end of this webinar, please kindly notice that you need to fill in the attendance list for this second session at the Google form. Please check the chat column for the link while allow us to show you the video of our comedy.
Aku percaya bahwa setiap yang kita rencanakan sudah ada yang menentukan. Dulu aku kira Dulu aku kira hanya harapan, tapi kini keberhasilan telah aku dapatkan. Dulu aku kira hanya mimpi, tapi kini kesuksesan bisa aku nikmati. Segala kenikmatan ini adalah hasil dari setiap langkah. Hal yang selalu kusyukuri karena telah berbuah indah. Namun aku sadar bahwa segala kesuksesan tidak lebih dari sebuah titipan. Dan aku ingin membuatnya menjadi lebih berkah dengan berbagi pada mereka yang membutuhkan. Karena ini prioritasku. Dan aku percayakan prioritasku ini pada Mandiri Syariah Priority. Dengan layanan Wealth Management Syariah yang mengerti kemana keberkahan itu mengalir. Untuk kini dan nanti.
Dalam masa pandemi ini, penting untuk kita menjaga diri di rumah aja. Tapi kita juga harus mengatur finansial keluarga. Mengatur finansial untuk antisipasi belanja kebutuhan yang mendesak. Atau untuk membayar cicilan yang harus segera dilunasi. Jangan sampai saat kondisi darurat kamu ribet cari cash money. Hidup jadi tenang jika kamu punya dana darurat yang bisa dipakai kapan saja. Solusinya ada di Mandiri Syariah. Dengan berbagai layanan yang membantu kebutuhan finansial kamu tetap aman. Seperti Mitra Guna Berkah. Pembiayaan yang bikin hati tenang karena sesuai syariah dan mampu mewujudkan semua rencana tanpa rasa resah. Prosesnya mudah dan biaya tetap lebih berkah tanpa bunga. Maksimalkan seluruh transaksi keuangan bersama mitra yang berkah. Segera pindahkan payroll di Mandiri Syariah.
Mandiri Syariah. Anda butuh dana mendesak untuk modal usaha, untuk biaya pengobatan, untuk biaya pendidikan, atau untuk kebutuhan lainnya. Gadai emas di Bank Syariah Mandiri solusinya. Gadai emas 1 juta di Bank Syariah Mandiri hanya 7 ribuan per 15 hari. Biayanya ringan kan? Pembiayaannya hingga 250 juta. Prosesnya mudah, cukup menggunakan KTP. Barang jaminan Anda aman. Penuhilah kebutuhan dana instan Anda dengan layanan yang nyaman, yang berkah sesuai syariah. Ingin tahu cara yang mudah agar Anda punya emas? Cicil emas di Bank Syariah Mandiri solusinya. Cicilan emasnya mulai 4 ribuan per hari. Cicilannya ringan kan? Hanya dengan KTP, prosesnya cepat, dan jangka waktunya sampai dengan 5 tahun. Cicil emas di Bank Syariah Mandiri adalah langkah awal memulai investasi dengan emas yang berkah sesuai syariah. Kunjungi website iGold di bsmemas.bsm.co.id. Caranya, klik di sini untuk registrasi awal, kemudian masukkan alamat email Anda, masukkan password, salin kode yang tertera, dan klik login. Kemudian, Anda dapat memilih melakukan simulasi gadai emas atau simulasi cicil emas. Kemudian, Anda dapat memilih kadar karat emas Anda. Lalu, masukkan jumlah berat emas Anda. Pilih jenis jaminan, klik submit. Maka, Anda akan mengetahui besaran pembiayaan maksimal yang Anda terima, biaya pemeliharaan, dan biaya administrasi yang harus Anda bayar. Berkah dalam satu langkah dengan iGold. Hubungi call center kami di 14040. Info selengkapnya di website resmi www.syariahmandiri.co.id.
Ladies and gentlemen, you might already wait for this information. The certificates of this international webinar will be able to be downloaded in the link that you can find in the Zoom column chat. Or if you use YouTube, you can find the link at live chat. The certificates will be sent to you within 2 weeks. At last, we are really grateful for your participation today. We also thank all the speakers and moderators, the Faculty of Public Health Universitas Indonesia, all members of Class 2020 Public Health Doctorate Program, Faculty of Public Health Universitas Indonesia, Organization of Profession, PPPKMI, IAKMI, PAEI, ED, and all the sponsors. We look forward to seeing you again at the next online seminar series of Faculty of Public Health Universitas Indonesia. Thank you everyone. Have a nice weekend with your families and always take good care of you and your loved oneself. Bye-bye. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Bermalam ini.
Ibu Rita kalau masih di ruangan, terima kasih banyak Ibu Rita. Terima kasih Bu. Terima kasih Bu. Masih di ruangan, terima kasih banyak Ibu Rita. Terima kasih Bu. Terima kasih Bu.
Terima kasih banyak Bu Rita, Bu Agustin. Bu Farida, terima kasih. Bu Farida, terima kasih Bu Farida.
Pertanyaan yang bagus dari FKMUI semua, yang lain pertanyaannya saya skip.
Iya, benar. Bu Agustin, saya juga ada pertanyaan yang pakai bahasa Inggris, tapi saya aja nggak ngerti. Ya udah, saya nggak bacain itu. Ada satu
pertanyaannya begini. Jadi apa bedanya antara Indonesia dengan negara yang berhasil? Lah, dari tadi dia dengerin apa? Aduh.
Itu tadi kenapa itu yang dari Thailand? Yang dari Thailand kenapa itu apa? Slides-nya nggak ada bermasalah?
Ada materi baru, Bu Rita.
Filenya rusak, Bu.
Yang panitia nggak bisa
Filenya
terbuka,
rusak.
Bu.
Kita download tapi rusak filenya. Jadi
Oh gitu. Oh dia kirim
kita keluarin file yang lama, nggak taunya susunannya beda. Jadi dia
gitu.
kirim
Dia perbaikin
selama-
gitu.
Ya selama seminar itu berapa kali ngirim update-updatean terus Bu filenya.
Jadi sambil dengerin dia perbaikin gitu.
Iya, betul.
Dan dia mic-nya kayaknya nggak bagus, jadi suaranya nggak bagus.
Aduh, akhirnya.
Ada
Jamnya
yang kesem Bu sama yang Hong Kong, Bu.
Hah?
Ada yang kesem sama yang Hong Kong.
Itu dari rencana lewat berapa menit Pak Ambo? Dari rencana ini berapa apa?
30 menit sepertinya.
15 menit, Bu.
15 menit, Bu.
15 menit, Bu.
Dari skenario.
Aku deg-degan juga tuh yang luar negeri itu pada ngomongnya panjang-panjang.
Benar.
Sesi
kedua yang banyak molor, Bu.
WHO paling panjang WHO.
Tadi Prof. Betty sampai karena beliau punya kegiatan lain minta izin duluan nggak bisa ikuti sesi diskusi.
Tapi
Iya.
sempat kok dia masih sempat dia jawab kok beberapa.
Yang Prof. Betty Bu, yang Prof. Betty.
Yang
terakhir, Bu.
Oh, yang terakhir dia nggak. Iya,
Betty itu kan sepupunya si itu, Bu Rita. Siapa tuh namanya? Temannya Pak Hadi
Oke,
tuh.
saya izin live dulu ya, teman-teman. Kami masih mau beres-beres dulu nih di sini.
Iya.
Makasih ya. Ya Bu, makasih Bu.
Oke. Ada. Oke, selamat beristirahat, sukses semuanya ya.
Selamat ya.
Terima kasih, Bu Rita.
Bagus Bu Rita. Sekarang bikin paper itu filsafat.
Diingetin, Bu.